You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Rosinya uli di sombranzelten meg e zuita saluda antes di niga Radzaudzan malakes fredzas durante todo memu a nogi distancia como gupugi palu zangiman malak guafi Ikonuna sugi airi prebatu la noci Nay banderada gaigi, pues atan fani bandera, kau esta pagua pumalala, giluk tanu man libri. Sentami ti man ko badi.
Take it how you want it, boy, yeah. Take it how you want it, boy, I'll be faithful. I promise not to hurt your heart, swear I'm not able. I loved you from the very start, my love's on the table. Take it how you want it, boy, yeah. Take it how you want it, boy. Boy, I'm all yours. Do it how you wanna, put me on your shoulders. Got me a soldier, here's the plan. Stay forever in my heart, always by your side, till death do us apart. Don't worry, boy, don't worry about a thing. You can put your trust in me. Say the word, what it is, it got you bugging. I'll be there whenever you are stressing. And when I do, close to you, all of your friends ain't got no clue. I just can't wait to be with you. I promise I'll make everything so easy. Boy, I'll be faithful. Promise not to hurt your heart, swear I'm not able. I loved you from the very start, my love's on the table. Take it how you want it, boy, yeah. Take it how you want it. Faithful. Promise not to hurt your heart, swear I'm not able. I loved you from the very start, my love's on the table. Take it how you want it, boy, yeah. Take it how you want it, boy. Take it how you want it, how you like it, when you need it, yeah. Take it how you want it, how you like it, when you need it. Take it how you want it, how you like it, when you need it. Take it how you want it, how you like it, when you need it. Take it how you want it, how you like it, when you need it.
All right, let's go. Good morning, Guam. Good morning, Guam. Morning, Sabrina.
Good morning.
Good morning, Jason Solis.
Good morning. Happy day, everybody.
Good morning, Harmon, as we get a shot of our beautiful Harmon Studios outside. As you can see, it's a little bit cloudy this morning. I did get sprinkled on the way down from the parking lot at 6:20. It
That's
is.
an understatement.
Yeah.
Were you guys woken up by the rain this morning? What was that, like 3 a.m.?
I went to
Yeah.
sleep with the sound of the rain.
It was pouring this morning. Like, not, right?
No, that woke me up. I was like, wait, could that possibly be rain? I was like, okay, that's rain.
I like to say raining cats and gutlagus out there. Cats and dogs. Good morning. Good morning, guys. Good morning, Guam. Good morning, CNMI.
Good morning, Dedado.
Happy day and good morning to Gun Beach.
Good morning, Sinahanya.
Good morning, Agania Heights.
Good morning, Tokcha.
Good. Go ahead, Christopher. Go ahead. Okay. Good morning, San Diego.
Good morning, Maina, home of the White Lady.
Oh, very nice. Okay, good. Good morning, Talafofo. That part when you come over the hill before you go down to the bay that you used to have to beep your horn. Remember that? Remember when we used to have to do that?
Yeah, I remember that.
I'm just going to keep it simple. Good morning, Pagachao.
Wow,
nice.
That's pretty simple. Good morning, Malolo. Good morning, Inalahan. Malesu, Pigua in the house. Kaneni Road. What?
Good morning, East Agania Bay, the part where the big fish, according to legend, took a bite and made a beautiful bay.
The big fish took a bite of East Agania Bay.
Yeah.
You better go back to your Tomorrow Legends book.
Good morning, CNMI.
Good morning, Cabris.
Good morning, Umatic. We got news for you.
Good morning, Santa Rita.
Good morning.
Did you want to say
I'm
something?
thinking. Wait, I covered a
He's
go.
still thinking of, well, what
Yeah.
could I say?
Good morning, Epal Beach. I said Gun Beach. Might as well go down to Epal Beach.
Hey, good morning, everybody walking over there to Assen Park in Assen.
Oh yeah, be safe, you guys.
Not Assen Park in Agania, not that one, the other one. Good morning, Adelu. Good morning, Anigua.
Good morning, Mungie Town.
Good morning, Paget Manila. Everybody on Back Road.
Good morning, MTM.
Oh, nice.
Good morning, MBI. Where's that?
Good morning, TGen.
Wait, what is MBI?
I don't know. Benjamin said good morning, MBI. So I'm just
Mariana's
repeating.
Brokers? Is that? All right.
Right on.
Good morning, EPAN.
Good morning, Dedido.
Good morning, everybody doing delivery services. We appreciate you guys. You guys are awesome.
Good morning, everybody in God's country.
Talafofo.
Oh, nice.
Ooh, good morning to Tuha.
Nice, yes. Good morning, Tumon Harmon. Good morning, Jigo.
Good morning, everybody.
And good morning, Americans out there in American states. Good morning on you, Bardstown, Kentucky. Also to all the Chamorros in Washington State, California, north, south, all around. Good morning.
Good morning, South Carolina.
Good morning, Florida.
Good morning, Las Vegas. I always got to say that.
There you go. And there
Okay, good morning, Oregon, or if depending on where you were born, good morning, Oregon. I never got that. How you do the pronunciation?
I'm still trying to get you too, bro. 623. It is the link on the breeze at 93.9. Proudly brought to you by First Wine Bank, Calvo Enterprises, and IT&E. As always, we've got a pretty ginormous show for you guys this morning. We got Robert Koss of the Guam Federation of Teachers Union. As there was something that was going around, furloughs at the Department of Public Health. Know your rights. So we're going to get Robert to come on and talk about the furlough process, which if anyone's getting furloughed, they're supposed to be following that. And we'll find out who falls under that process and all that good stuff. Also, Maria Pangolina, the Guam Election Commission Director, as the general election starts on Saturday, right? I mean, officially.
You got to start, make your appointment first.
There you go, by appointment. We've got Dr. Hoa from the PAG. They had a PAG meeting last night. We know that they talked about, what was it called? Data-driven decisions with reopening businesses during the PCOR 1 lockdown. So we'll talk about that. We've got Mayor Johnny Kanata. Who's ready to go to Umatic? You guys ready to go to Umatic this morning?
Yeah, love that drive.
I didn't even know as I strolled through there the other day, they built these new pavilions on Umatic Bay. I don't know if you guys saw that.
No, because I've been staying home.
Right. I was on the way to Essential.
Okay, well, when it is safe to travel, when it is safe to travel, right? I'm saving.
I was gonna make a point, Sabrina.
I'm
sorry.
saving your
Yeah.
butt here, bro. When you guys go down to like Umatic, you know, for whatever, for Discovery Day, for the Fiesta, for what, do you guys prefer to go through
Oh, God.
Agate Umatic Road, or do you guys go like through Jotnya?
I
and,
prefer
like,
to
all
get
the way down?
airdropped in with a helicopter
Well, I only got one job.
on a woven coconut rope with just a freaking Saudi.
Yeah, I always like going, you know, the longer way, like through Jotnya, and you pass like all the
Yeah,
villages.
so
and-
they built these pavilions on Umatic Bay, but it's kind of sad because they're all caution taped off because you can't gather. And so anyway, 626. Good morning. Let's go ahead and just jump right into the show. Again, we've got there's a whole lot. Okay, we've got John Fernandez, GDOE superintendent. We've got a few of your senators. We'll mix it up with the legislature, if you will. We got Senator Kelly Marsh, Senator Tello Taitigui, Health Chair Senator Therese Terlahi to talk about the threat of furloughs.
Dun, dun, dun.
All right, dun, 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 and the budget and all that good stuff. We've got Public Auditor BJ Cruz. I had to call him yesterday because the Gore director kept dropping the Office of the Public Auditor when he was talking about his 4% raise. What a crazy interview. If you guys got a chance, go back and watch that Ray Tapasnia interview. That was just, it was. I have a feeling he got sent to the corner yesterday after that. We've got Public Auditor BJ Cruz coming on, and then we'll catch up with a new sponsor on the show, the Thrive Coalition. It takes a village to raise healthy and drug-free youth. That's happening around 9:30, 7:40. We'll get Public Health PIO Janela Carrera in with Vince Munoz and Monica of the Galati Group. They're pushing the app, the Guam COVID-19 app. People are talking about. Sadly, I mean, I guess people are talking about not downloading it more than they're talking about downloading it. And so we'll go in on the app with them, find out how many people have got it. And we'll ask, how crucial is it that we download this app? Because they're saying if we do, it's going to help us turn the corner in the fight against COVID-19. So we'll get them on to talk about that. Again, it's all on the way here on The Link, The Breeze 93.9. Now let's just get into the news at 6:27 from the KUAM News team. Good morning, Sabrina Salas Matanani.
Excuse me. Alfred, everybody. Hope you're all doing well. The island recorded 2 tragic COVID-related fatalities Tuesday. The latest one was an 84-year-old. He was Monsignor David Ignacio Arceo Quirigua, who was the uncle of Congressman Michael San Nicolas, who confirmed his passing to the media. In a statement, the congressman said, quote, "This hurts bad in a time of much pain and ugliness. It was always reassuring to know that a man of such holiness as Monsignor Quirigua was not only there as a spiritual guide, but as family. This past year has been hard, and it is made harder still. But Lord, we declare that all good things come from you. He was of you. We present his soul to you, and we pledge in our pain our devotion to you. Amen." The Joint Information Center did not identify the Monsignor, but in a release Tuesday stated that Guam's 28th COVID-19 related fatality occurred at the Guam Memorial Hospital at about 4:30 p.m. The patient was an 84-year-old man and had underlying health conditions. He was initially admitted to GMH on September 3rd and tested positive for COVID-19 during initial workup. The Archdiocese also confirmed that the 84-year-old Monsignor Quirigua passed away, but did not disclose if it was related to COVID. Monsignor Quirigua was Pastor Emeritus of San Juan Bautista Catholic Church in Orat. He had served as pastor there since September 1993, before his retirement 4 years ago. Archbishop Michael Burns extends his deepest prayers and condolences to the Quirigua family, his fellow clergymen, and all in our Catholic Church and community in general. Meanwhile, prior to the Monsignor's passing, Guam also saw the loss of another individual related to COVID. The Joint Information Center reporting that a 45-year-old woman passed away at 3 o'clock Tuesday afternoon at GMH. She was admitted nearly a month ago on August 17th and subsequently tested positive for COVID and had underlying health conditions. These latest deaths marks the island's 27th and 28th COVID-connected casualties. As for Guam's COVID case count, out of 435 samples that were ran at various labs, there were 39 new infections. This brings the total number of people on Guam to have caught COVID since March to 1,966. Of that number, 626 people are actively fighting the virus, while 1,312 have recovered. The Pacific Islands Club announced it will lay off 119 employees by mid-November as a direct result of the COVID pandemic. In a news release, the hotel also said 436 employees will remain on furlough status. Hotel General Manager Ben Ferguson saying, "We are hopeful that tourism to Guam will resume by the end of the year, but we are mindful of the reality that arrivals to Guam from our key source markets will take an extended period of time to recover." The PIC says since the recent lockdown and the transition back to PCOR 1, its occupancy rate is less than 2%, and 2 of its towers have been temporarily closed. The battle over the budget is over as senators voted 12-2 to override the governor's veto of the fiscal year 2021 spending plan. Nestor Lecanto reports on the real fiscal work that is yet to begin.
Guahan is called to order.
Less than a day after voting 6-8 to reject the governor's substitute budget bill, senators met again and voted to resurrect the spending plan they had passed on August 31st. Only Speaker Tina Barnes and Senator Regine Bisco-Lee voted against the override. But as Senator Kelly Marsh Titano points out, they still stare in the face of economic uncertainty.
This is the beginning of this conversation. It is not the end. We are here to observe the data as it continues to come in. We are here to listen to the agencies. We are here to work with the governor on behalf of the community. We are here to grow the economy and grow more revenues.
It is the revenue projection, though, that was in dispute. The administration wanted about $7 million more in spending than the legislature had projected, and the governor had warned she needed at least an extra $5.8 million for Medicaid matching funds to maximize the allotment. But Health Chair Senator Therese Terlahi, who was on the receiving end of a scathing letter from the governor who was critical of her lack of support for DPHSS, said the reality is they will need to find other ways to get the money.
FY21 is going to be tough all around. And the $64.2 million cut that is being made to Government of Guam operations is going to be felt significantly, even by our most critical agencies. There's compromise going forward, of course, just as there was compromise to get this bill passed. And I do believe we can look at revenues as they actually get collected, and of course, adjust appropriately. Give public health and these other agencies what they need as it comes in.
For Guam's News Network,
Speaker Tina Munya-Barnes said she voted against the override because it was recently brought to her attention that 80 individuals from public health will be furloughed. According to the government's furlough procedures, the director of public health must first submit a request to DOA for authorization to conduct a furlough within 6 months of the proposed furlough. If DOA approves, then a 3-month notice is then issued to all employees that a furlough is planned. Meanwhile, reacting to the override, the governor says the budget law now represents a clear and present danger to some of the most basic services at public health. It will force us to cut services for our elderly, our foster kids, vulnerable adults, and our COVID surveillance and contact tracing unit. And it will likely mean the reduction of hours at the judiciary of Guam. Our job is to manage these consequences as best we can. We fought for a better budget. Now we will seek amendments that make this budget worthy of our people and the healthcare heroes that serve them. There's been a quick reversal of the governor's order to shut down construction work. Public Health issued a directive effective yesterday authorizing construction to resume after, quote, reviewing operational plans and inspecting construction facilities to ensure COVID mitigation measures were in place. Governor Lulian Guerrero ordered the shutdown after a large cluster of positives was recently reported at a pair of construction barracks. But in a letter to the governor prior to the government's announcement, GCA President James Martinez wrote that it was, quote, unreasonable to impact an entire industry over COVID positives at one or two companies. Martinez says that when a single gas station, grocery store, or bank branch reports employee infections, the entire petroleum, grocery, or banking industries weren't shut down. In comments to KUAM, Martinez had called it a double standard and that the GCA was never consulted about the blanket closures, as it wanted to work with the governor to offer alternative solutions. In national news, at least 24 people are missing in California. More than 3 million acres have been burned, and about 16,500 firefighters are trying to quell the flames. This eerie footage is from the city of Talent in Oregon, where burned out streets look like they're paved with pink flame retardant. Jonathan Vigliotti is tracking this historic disaster.
Crews are using cadaver dogs to search through charred rubble in southeastern Oregon, looking for any sign of the missing.
Oh my God.
Fast-moving flames ripped through nearly half a dozen towns last week, giving residents little time to escape. Even heavy-duty fire retardant was not enough to save these homes. Some, like Ashley Britton, are seeing the destruction for the first time.
It's the worst thing I've ever seen in my life. I had seen videos, but it's 1,000 times worse than I could have ever imagined.
Firefighters across the West have been battling shifting winds as they try to gain control of more than 100 fires. The hazardous smoke is so severe, the National Weather Service says it has created a haze across the country, all the way to Washington, D.C. And Alaska Airlines announced it was temporarily suspending flights to and from Portland, Oregon and Spokane, Washington due to the smoke. Dave Monroe lives in hard-hit Talent, Oregon.
There's something going on, that's for sure, man, because it's one thing after another. Every summer we're burning up.
In California, wildfires have now burned an area larger than the size of Connecticut. The state's governor, Gavin Newsom.
I've been on so many fires over the last 7-8 years throughout the state. We've never been more stretched in our resources than over the last month.
And the fire where we are is the deadliest so far this year in California. It is 40% contained. In Oregon, mobile morgues have been brought in where more than 24 people are still missing. Jonathan Vigliotti, CBS News, Chico, California.
An investigation has been launched into the death of an individual that was found unresponsive Tuesday at the base lodging on Anderson Air Force Base. The name of the individual is being withheld until family is notified. According to a media release from the air base, our chaplains, mental health professionals, and counselors are available and ready to assist those in need. And finally, Public Health is offering community testing in Umatic this weekend. The catch, it's only for the first 200 participants who register with the Umatic Mayor's Office. Testing is scheduled for Saturday from 9 a.m. to 12 noon at the Mayor's Office. To register, you have to call the Mayor's Office at 828-8251. That's 828-8251 from 7 a.m. to 4 p.m. Priority will be given to residents of Umatic. However, registrants from other villages will be accepted if space is available. For the safety of the community and the nurses, only 4 people per car are allowed to be tested. No symptoms are needed. To qualify for testing, individuals who've registered are asked to bring an ID if one is available. And that is your news.
The 2020 Census of Guam will conclude its primary data collection phase on September 30th, 2020. Call 645-20...
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
Hafa Adai, my name is Zena Cruz Piscina, a registered nurse with the Department of Public Health and Social Services. COVID-19 continues to be a very real threat to Guam. Wearing an appropriate cloth face covering in public is a simple and important way you can protect yourself and others on our island. During a pandemic, no single action will stop the spread of the virus. Wash your hands often with soap and water and stay 6 feet away from others. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior, such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6
at 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. to you today.
So go and get your roots, 'cause that's all you got. I know that.
I just gotta let this one rock for a little bit. Good morning. Thank you guys to our Facebook Live viewers on our KWAM News Facebook page. Good morning on you. Also to our listeners. Yep, The Breeze, where your go-to jam is always on the way. It's The Breeze 93.9. Good morning. Good morning, KUAM TV. It's the 16th day of September. Shay.
Wow.
Yeah.
When you say it like that.
I know. It's like
With
September.
emphasis.
With gumption?
Yeah.
So what was it? 2 days ago was exactly 6 months when the first cases were reported. Sabrina and I were there at Civil Defense when the governor made, a startling announcement.
Right.
Not just one case. It was 3 cases all on that one night. And us being in the media and covering a lot of press conferences over there, you could have heard a pin drop from all of our colleagues. Everybody was, we all kind of anticipated what was coming, but it was like, wow. There have been people that have been doing this, 15, 20 years, and everybody was so silent.
Yeah, I remember thinking in the end of February how slow this year was going by. I remember I had a moment where I was like, man, this year, it's only February? What? Now we're like, what? It's September? Oh, you get the point. There's a lot going on. Time flies when you're in a pandemic. 6:44. We'll go to the KUAM News Zoom room. We're just going to get Robert Koss from the Guam Federation of Teachers Union on. First of all, Robert, thank you so much for joining us.
Oh, good morning, Chris. Thanks for having me on board.
Always. Anytime. How's your coffee this morning, Robert?
Is it hot, black, and bitter?
All right. Let's get right into it, man. So we had heard out of the Speaker's office, which was an interesting place for it to come, that there was a possible threat. I'm not really sure what to make of it because did we get anything official out of Public Health?
No, we didn't get anything from Public Health. You were the one who was calling
Janela.
Arts Augustine in Janela. But, I did ask for a comment from Adelup regarding the statement that was issued by the Speaker about the 80 furloughs. And, this was the response that I got, that the Speaker's comments were in reference to BBMR Director Lester Carlson's testimony during the budget session, in which he noted that the operational funding for public health is dictated by the budget, which is now law, is inadequate to cover both warm bodies and federal overmatch requirements for programs that serve senior citizens. To put it simply, if all warm bodies are covered, we may not adequately be able to fund senior citizens programs that require federal overmatch. If we do, it could adversely affect personnel presently on staff. That was a statement from Adeline.
Is that English? What is that?
I know. I said, is this the comment? And,
yeah.
Crystal was like, yes. And I was like,
okay. Well, you have to run it through the Adelup decoder ring, and it basically comes out that you become the thing you hate. Because what I thought about yesterday was how much energy did Adelup and Carlo Branch and these guys throw out about former Governor Eddie Calvo and closing the police stations, the fire stations, and now I just feel like they're doing the same thing. I mean, you went 0 to furloughs at Public Health in
Contact
real
tracing.
quick, right? So we're going to bring Robert on it, and again, I don't know how much of this is political grandstanding or what, but if we're hearing the F word, right? Furloughs, guys. If we're hearing the F word, then I think we want to just kind of inform people in the union and anybody else, if you do have that info, about the actual process that goes into place. So go ahead, Robert.
Yeah, well, I think you might be onto something there. We know during the Calvo administration, the F word, it came up frequently, but there were never actually any furloughs conducted. And I believe at that time furloughs were used to basically scare employees in order to push political agendas. The Lou and Josh administration have been very adamant that there are not going to be furloughs or layoffs, during their administration. I really appreciate that. And this is the first time that it's come up. It did not come up from the administration. This issue was breached yesterday by the legislature. Typically the legislature gets involved after the governor makes a determination that a furlough is necessary. So it is somewhat unprecedented, unusual.
Yeah. Now I got to run what you said through the Dakota ring, and
So what is the process if the government is to implement furloughs, and what protections
if the
do federal
government,
employees have?
if they're going to implement a furlough for financial reasons, that may be legitimate. You know, with how much money did we get from the federal government this year? $1.5 billion.
Right.
Does that sound about right?
Something like that.
And the total operating expense of the government of Guam is about $1 billion.
Mm-hmm.
So it seems to me there ought to be a whole bunch of money in savings, you know? And if we can, you know, get this economy back on its feet, I'm not sure that, you know, I think there will be enough money. And, you know, this is not even considering what federal funds we get next year. But if they're going to proceed with the furlough, there's some things that we're going to be looking at real close. Is it truly warranted? Is it necessary? Did they seek volunteers? That's going to be an important one. Were employees given their bumping rights? This is one of the pains of doing a furlough is you've got to assess the retention points for all employees. And then any employee who's been identified for a furlough has to be given opportunity to fill other positions, including bumping employees out of their jobs. It's a very I don't know. It's a process that's going to create a lot of upset employees. I'll tell you, not just the ones that get furloughed, but then the ones that they bump as well. There's going to be a lot of complaints. I'll tell you. And then you know, in addition to the those things, it's the notice requirements. You know, did they meet notice requirements? You know, we're dealing with people who have children, people who have mortgages and bills, and, you know, people who need to be able to plan for what's coming their way. So these notice requirements are really, really important. There are general notices and individual notices. And once you receive the individual notice, I believe that's when the bumping rights start. So the nurses might be willing to take a voluntary furlough. I mean, a lot of them are just beat. They're just exhausted and ready for some time off. So, you know, if they do this at Public Health of all agencies, you know, I'll be watching.
And realistically, if furloughs were to occur, how long of a process would it take to actually see something like this happen? Because when I was just reading over the procedures, it seemed like it would take quite a while.
Right.
You know, because you have to have that 6
Well,
months.
there is a lot of work.
Yeah.
You know, that process of assigning retention points for all employees. I know that your HR administrators were tasked to ensure that those were kept up to date. If they've done their job, it might be easier to furlough employees now than before. But if those retention points are not accurate and up to date, they're going to have to be computed. You know, and there's lots of things that come into that. They've got to review evaluations, years of service. They're going to have to go over all the personnel actions, even disciplinary actions affect those retention points. So a lot of records have to be reviewed to keep those retention points up to date. That's going to be something that DOA would do. They're going to need time to complete that process. I don't know if they're shorthanded or if their employees are also under PCOR 1 right now. You know, it might be very difficult to accomplish.
Robert, I know you're talking about the protections and the procedures that are afforded to members of the GFT, but just riddle me this, right? So what about the unclassified political hires, temporary workers who aren't members of GFT? Are you familiar with the process for those people?
Yeah. Esta. That's it. All they got to do is send them home. They have no prescribed rights in the unclassified at-will employment. They serve at the pleasure of the governor or their agency head and can simply be let go and recalled at the whim of the agency head. Those employees do need to be released before they start tapping into the classified employees. I would remind the government of that because a lot of time, you know, these are, well, anyway, that's the process.
Yeah, they're political hires, Robert. It is what it is. Although I do know that
I didn't want to say it.
right, but there are some positions in public health unclassified that are filled by, technical or professional staff, and then there are those who are just people that get moved around or whatever.
That's right.
But-
And the other thing I would point out too is anytime they do a legitimate furlough or they pursue one, the legislature always steps in and they change the rules to make it easier for the government to accomplish. And so, that's something that we need to kind of take into consideration. Hopefully our new legislature will step up and say, no furloughs, pass their law and stand firm that we're not going to furlough employees. It is absolutely the worst thing that could happen to our economy right now. Private sector is practically non-existent at this point. It has just failed. There's so many people out of work. The whole economy is relying on largely government employees who are still working. And now that pool's going to start to dwindle. There's not going to be anything left to rely on. We'll start a downward spiral that we won't be able to get out of. It'll be a disaster.
Well, thanks for bringing the sunshine.
Yeah.
So, but just at
well,
the
if I had to rely on commercial ads, I'd be concerned too.
Yeah.
Because that's another thing that's going to be affected.
yeah, we're concerned, no doubt about that.
We're feeling it, man.
Yeah, but just for clarification, before anyone is furloughed in in let's say public health, because this is the agency that's been thrown around, before anybody at public health can be furloughed, they have to let go of the unclassifieds first before they tap into the classified public health employees.
That's correct.
Okay.
Yeah, that's correct.
All right.
Well, all you unclassifieds better be really nice to your bosses this morning.
Anything else, Robert? I mean, I could ask you a couple other questions, but
Yeah, I just love to send the message that the people of Guam need jobs. They need good paying jobs. They need a job that's going to pay wages well enough to put a roof over their head and food on their table. And, if we're going to, this COVID thing has taken the poorest of our poor and knocked them down even lower. It's taken, our family businesses, our small businesses, and almost, it's probably destroyed most of them. Many of them say they won't be able to afford to come back. So it's knocking the rungs out of the ladder for the poor to climb out of poverty, for middle class to establish businesses and try and climb up. Those rungs are being taken out of the ladder, and the only people surviving are those that have large amounts of liquid assets in the bank. And generally, that's a very small percentage of our economy. And I think we're headed for big trouble. There's going to be a lot of dissatisfaction. People are going to do whatever they have to do to survive. And I don't think we're going to like it. This is the wrong direction to go. And the legislature, I think our governor knows this very well, but I'm not so sure the legislature does. They should not have gone down this path. They should have adequately funded the government of Guam and leave it to the governor. Let it be her problem. Let her deal with the fact that the revenues didn't come in and there's not enough money, because she can ask for federal relief. At the end of the day, that's what Guam is. We survive on handouts from the feds. And so there's no reason for the legislature to underfund our government. It was a very bad move on their part.
Got to close by asking you about the double pay lawsuit, because I don't know if we just kind of hung up the jersey on that.
So apparently my attorney thinks I talk too much. It's been filed, and we're pursuing that. And I have been asked not to talk about it. This is a case that's between my attorney and who are now his clients, and I'm not a party to the suit.
Right. Where was it filed at, so we could get a copy? Or are you allowed?
It was filed in the district court.
Like yesterday?
No, some time ago.
Okay, I'll look it up.
Well, thanks for the heads up, Robert.
He's
Well,
not supposed to
again,
talk about it.
I've got a job and I've got a boss.
So,
we all have our drums that we have to march to, right?
Right on. Okay. Thanks for joining us
Wait,
early.
wait, wait. But by any chance, have you received any other sorts of complaints?
Right.
Over at the GFT that you guys are looking into?
We're hearing about overtime being way behind. Hazard pay or what is it?
I just heard that some people aren't getting.
Oh yeah, well, I think there's always, and particularly right now, lots of payroll related issues. We have concerns from the the nurses who are being transferred from DOE to GMH, whether or not they're qualified or trained to do that kind of work. Concerns that government nurses were transferred to a private hospital at GMRC. Those are the sort of things that we've been dealing with. Teachers, of course, the no formal training for distance learning. They're out there trying their best. I think most of DOE is pretty considerate of the fact that there really is no formal training for this and that they're trying. But there are some school administrators who may be a little bit unreasonable with certain individuals. So we got those kind of things. But for the most part, I think public employees have been very understanding and patient. They've been stepping up to the plate when they're called and doing whatever they can to help out. And a lot of these first responders are getting sick, and there really hasn't been any appreciation shown to them. I am shocked, how we treat our heroes on Guam. I would think that our heroes would be rewarded and appreciated, but they're not. They're overworked until basically they get sick and can't work anymore, and then they're disregarded. GMH saying that nurses are not getting sick from work, that they're getting sick at home. This is an attempt to avoid what? Workers' comp, maybe? Avoid paying or so they can bill them for their medical bills and charge them for their leave after they do 12-hour days at the hospital and finally catch COVID virus. So there are some concerning behaviors out there. We deal with them individually.
Are these actual complaints
sounds like
that
a
are
lot.
filed with the or grievances, or are these just phone calls expressing concern?
It's under PCOR 1, there's a lot of employees who are working from home or have other arrangements. Makes it very hard to do a grievance. Civil service and DOA are involved, but these are aspects of their agencies that are not functioning right now.
I see.
So it is very difficult to grieve. Talking with my attorney, if there's no remedy, we just take it straight to the court. So we're looking at that, but that's also very expensive. And the courts have they're handling a limited number of cases right now as well. They have downsized their operations, so all of that just gets put on the back burner. It's tough right now. It is tough for employees, and I don't know if management realizes it or others in our community, but our employees are I'm impressed with the effort they're making and the expectations that are being placed on them.
All right.
Well, thanks for that, Robert. Thanks for that check-in, and there's a bunch of stuff there we can follow up on, so appreciate that.
Oh, you bet. Anytime, Chris.
Yeah.
Anytime.
Well, don't be a stranger. Don't wait till I get you on the link here to spill the beans. Shoot me a text once. I mean, I like it though. I like it. We should just do a weekly confession with Robert Koss. Okay, thanks, Robert.
I've been doing this for 20 years, probably because I haven't been on TV.
Right. We'll see you.
Otherwise,
Take it easy.
Throw me off the island a long time ago.
Take care.
Wash your hands. Stay home.
Thank you, guys. Thank you very much.
Right on. 7 o'clock or KUAM FM in Agotnia, Guam. Let's go back to the KUAM newsroom. Dispensa, Miss Maria, I know that we had you on for 6:35. I didn't know that Robert Koss had all that juice to spill. So good morning. Let's bring on Maria Pangilinan, the Executive Director of the Guam Election Commission. Good morning, Miss Maria.
Unmute.
Chris and Sabrina.
Sorry, Lai. Are you okay?
Good morning.
Good morning, Miss Maria.
Good morning. Can you hear me now?
Yes.
We can hear you now. How can you hear us now?
Yes, I can.
Okay, so we can hear you. You can hear us. Good morning.
Half a day.
So what's going on? In-office voting is starting back up?
Yes, we're getting ready. I don't know what time the staff left last night. I left before them. The canopy is up for curbside voting. Third floor is just about ready. And we visited Malesu over the weekend to make sure we're ready for September 26th. In-office voting for the general election starts this Saturday here at GCIC building on the third floor. You can call 477-9791 to make appointments to come to GCIC building third floor, or if you are medically challenged, or you're a person with a disability, or you're a real menamku, you can make appointments to vote curbside. And that so our schedule is 9 o'clock to 4 o'clock. We will take appointments every day, Monday through Friday. And then on Monday through Friday, starting September 21st, up until October 30th, we will have in-office voting here at GCIC Monday through Friday from 9 o'clock to 6 o'clock p.m. At the first hour at every location is reserved for Menamku. At the satellite locations, we are going out to 4 villages, one village at a time.
You sure?
Every Saturday, starting September 26th. So on September 26th, we will be in Malesu, and we will open at 9 o'clock. No appointments necessary. First come, first serve basis. Again, I want to stress 9 to 10 o'clock is reserved for Menamku. If you're not registered to vote yet, up until October 23rd, you can come to our office, go to our satellite locations, and register and vote at the same time. Bring your photo ID, wear your mask, bring a blue or black pen, visit our website at gec.guam.gov and look at our sample ballots. They will be up shortly. Also, follow us on Instagram at Guam Election.
Yay, Instagram.
Hey, a day now, Fancio. Wow.
Is that from Kenny Boo? Did he help you guys out with that?
Yes, he is.
All right.
What, are we gonna get like
we
selfies
miss
of
you,
Maria?
Kenny Boo.
No, he's doing a great job. Thank you.
Right.
So, Maria, I understand you guys approved the voter safety plan, right?
Yes. And so it was submitted Monday, September 14th. That's when it was due.
Mm-hmm. Can you take us through a little bit of that?
Okay, so we outlined for them the ballot security, how we will, how we make sure that we take the ballots out of our vault and bring it back every night. We make sure that we assure them of the same COVID-19 minimal spread, or minimizing the spread of COVID-19, all our measures that we started up at Jordan Special Election. And we're also, in our safety plan, we also outlined that we will have additional employees to help us here at in-office, and also to make sure that we will continue to frequently touch surfaces, at the voting booths, before and after every voter. When we go to the polling sites, we will disinfect the whole room before and we will also disinfect after.
Okay, let's move on to because we do have some questions from people online. They're asking about homebound voting. Are you guys going to be doing that?
Yes, we are waiting for Department of Public Health. We work with them very closely. We are waiting for them to give us a little bit of training on homebound voting and to give us the correct guidance on how to do it.
Mm-hmm.
We will start Monday, September 21st with homebound voting. We have those people that requested for homebound voting on for the primary election. We have their names. We will call each and every one of them and make arrangements. On the days we're at the satellite locations, we will focus on those villages. So call us at 477-9791. We will take information over the phone for those that are requesting homebound voting. Please know that homebound voting is reserved for those that are truly homebound. We will service the hospitals. We will also service the quarantine facilities, again, with public health guidance if there are any voters. The hospitals and the quarantine facilities, we will service them closer to the election.
Mm-hmm. We have a question about off-island voting.
Those will be mailed out on Friday. That's tomorrow. The federal government requires us to mail out what we call UOCAVA voters, the military and overseas voters. They require us to mail their ballots 45 days before the election. That's September 19th. Because it falls on a Saturday, we're required to mail them out tomorrow.
Wow. Are we going to be able to do that?
Yes, we are trying our hardest. We've talked to our Department of Justice point of contact, which is standard procedure. We assured them that we will be able to mail them out tomorrow.
Okay, and I know this is
I'm sorry, not tomorrow, Friday.
Right. Not tomorrow if you want to be ahead of schedule.
Friday is the day we're going to mail them.
Okay.
Any reports or anything due? Like candidates or anything like that?
Their final primary report was due Monday, September 14th.
Oh, wow.
Everybody turn.
We were trying to, I think the staff got a list together last night,
Oh,
but I don't have it handy with me
Okay.
today.
On who filed and who failed to file?
Yes, I don't have that handy.
Okay,
Were there a lot of failures to file?
What was that, Chris?
Were there a lot of failures to file?
I don't think so. What we did, because we are not able to, because of the stay-at-home order, we were not able to accommodate them in person. So we required them to get it notarized outside. No.
Oh, let me
and
ask-
then they emailed us. They emailed us both the notarized PDF copy and the Excel copy. So I saw my email was really busy receiving all those.
Miss Maria, we had a comment here. If the homebound is due to COVID-19, how will the ballots be disinfected? I don't know if you addressed that, but are people who have COVID-19 going to be able to vote?
We're working we're going to talk with public health. We continue our dialogue with public health to show us how to do it. I know that in the Junior special election, we serviced somebody in the quarantine facility. So we are working really hard to make sure that nobody's right to vote is disregarded.
Right.
Maria, so all of this starts Saturday in terms of the in-office voting. What if the PCOR 1 is extended? This stay-at-home order, will that extend?
Again, we are working with our public health. Public health is aware of our situation. They put together the guidance for the orders the executive orders that come out. And so we anxiously await our conversation with them to let us know. We know that stay-at-home the current stay-at-home order ends on Friday. So we're anxiously waiting to see what happens.
What'd you hear? Did you hear anything?
I haven't heard. So, on our press release, we said that it's subject to change. And
Right.
it's subject to change based on what executive order is released.
So you didn't hear anything?
No.
Okay.
You sure?
Did you?
No, I'm checking with you because you sound like you're moving full steam ahead, and that tells me
You
that
have to, though, right?
probably you heard something.
No.
They got a plan.
I haven't heard. Yeah,
Just between us, Miss Maria. Hold on, I'm just gonna put don't listen. Did you hear anything? No, still. Okay. All right, Maria Pangilinan, the Guam Election Commission Director. Anything else, Sabri?
Yeah, just wanted to follow up on. I know you mentioned the COVID. So same thing goes with the isolation hotel, right? For voters that are there, you're just waiting for guidance from public health. Okay.
All right.
Yes.
Good stuff.
All right.
Well, thank you, Miss Maria. Jay, did you get to ask about the machines, or we're good? Okay.
I can do it.
We'll ask you next time. Jason
Yeah.
wants to do a whole video with the machines. And
Maybe
all.
we could get Kenny Boo to do some stuff.
Right.
Some online
Guys,
stuff.
if you're just joining us, Kenny Boo is Ken Quintanilla, the former KUAM News reporter. I don't know if he wants to be referred to
Sorry.
as Kenny Boo.
We got terms of endearment on the show.
Right. I mean, now we turn to Guam Election Commission. Kenny Boo. Kenny Boo. Hey. No, and so he's over with you guys helping with the election. So that's a good pickup for you guys, Miss Maria.
Yeah. All right.
Thank you. She's still there?
Are you frozen or?
Are you frozen, or you just want to tell us that you heard something?
Miss Marcy, you too.
Thank you. Okay.
Take care.
Last chance. Esta, Miss Maria. Okay. Just like Robert Koss said, Esta! Let's keep it going in the KUAM News Zoom room. I think he heard something. We'll bring on Dr. Hoa Wen of the Physicians Advisory Group. Good morning, Doc.
Good morning, Chris, Sabrina. Hi, Jason.
Good morning.
So what'd you hear, Doc?
Good morning.
What'd you hear about the...
Most likely, I think we're going to stay in Pico 1.
Oh.
I don't think we're going to get out this one yet. The hospitalization is still pretty high. We have a few deaths yesterday. I think we still have like 10 patients on the vent. So I don't think the situation slowed down. Clinic-wise, there's a increase in number of sick visits in the past 2 days. There's a few positive cases that out in the community that started to pop up. So I think that we really need, some help in the community. And I know people are starting to get kind of impatient on the lockdown, but we still need to really focus on what we do and be disciplined and try to stay at home. I think, as you can see, that the group that have the highest rate of increase right now is the 20 to 40 years old. And those people really need to somehow, one of the physicians say that this, we need to identify the problem and educate the appropriate group. I tell you, the group that really bring everything down is the 20 years old to 40 years old. I mean, those are a group that I'm not quite sure what they do, but their rate of increase is still so high that it's affect the whole island. So if you guys have a recommendation, let us know. But the 24 years old, they still socialize. They still bring the virus back to their family, and we see that still every day. Because the people in the hospital right now are not the people that are moving around. There's a certain group that bring them back home and affect their own family member. So if you're 20 to 40 years old, please stay home and try not to put yourself at risk, because your risk, you will bring it home to your family. So yeah, I mean, I don't think we're gonna get out of Pico 1 this week yet. So I don't like it, but I don't think we have a choice. So, but that's the governor decision again, But I think that it's hard to get out Pico 1 with a stay-home order when the rate's still in the 20-30 and the hospitalization is still so heavy.
Right. And so the testing positivity rate, because I've noticed that we're not testing as many people as we were before, but the rate, it's still up there, 9-10%. I mean, yesterday it was just about 10, right, Jay? About 10%. So, Doc, what can you tell us about who's getting tested right now? Because we saw on the other day that Public Health didn't run any. Right?
Yeah, it was a 0 at the lab. So it was kind of like, why wasn't there any samples or tests ran through the lab or conducted? I want to say was it Monday or?
Yeah, we don't have the mass testing anymore, guys. We basically on a test run right now. Mostly people that's sick can come to visit in the clinic, and I know they're going to try to do some target testing, especially on dialysis patients. I tell you, that's the biggest group at risk at this point. Again, the message I've sent I think a week or two ago is that if you have a family member on dialysis, you really have to protect yourself and protect your family member. It's very hard. The dialysis patient, when they hit the GMH, they're gonna stay there for 2 weeks, and there's all kind of chance that when they stay at GMH for 2 weeks, they're gonna get other form of infection because their immune system is so low already that in the environment in the hospital, doesn't matter how clean it is, they're gonna catch something and they're gonna get in trouble because they can't leave to go home. Outpatient dialysis center will not take them, so so they have to go to GMH to get dialyzed. And if the GMH don't have the staff to dialyze those patient will get in trouble. So if you have a family member on dialysis, man, I tell you, I would go to work, go home, that's it. No family member come over for dinner or for lunch, whatever, because you got to protect them. Because if we don't, we're going to lose one by one on the dialysis patient.
Mm-hmm. You mentioned again that 20 to 40-year-old demographic. Do you know where they are they working, where they may be going? I know Dr. Cabrera was talking about mobility data. I don't know if that tracks, where people are going or what, but do you guys have any idea?
Sabrina, I can tell you what I see for my patient, right? I mean, that we take a pretty, comprehensive history because we want to know what they do. And most of the time they say, I just have a friend come over for dinner. It's still the same. They still get together for dinner. And now, like yesterday, a patient, my friend just came over for dinner last week. Now they're sitting there sweating, fever, have a hard time. And those are stuff that, I miss my friend. And I miss, having dinner with my friend. But at a certain point, we had to push that out to them. That they are the main vector right now. They need to be, respect their family, and they need to kind of, socialize in a different way. But they cannot get together for dinner anymore. I mean, that's something that everyone says, "Oh, I didn't know I can get it," and how do I treat it? Say, you don't have no treatment for this one. You go home and you have to stay and hope that it get better rather than get worse. Mm-hmm. So we don't have the treatment yet. People got to know that. I still ask the same question.
Mm-hmm. So in terms of the PAG meeting last night, what all did you guys discuss? Did you guys discuss this recent decision from the Superior Court with regard to quarantine?
Yeah, the most we spent a lot of time on trying to push this 7-day test out quarantine for our Q factor, so that way people can go home earlier, right? And that's the main thing. We don't want to keep people for 14 days, and that's quite a long time. And so testing out at day 7, we have no problem at this point. It's feasible. We can do that. The other one that we try to push, the government want to get this thing to go move really fast, is get the SARA alert on board. We've been working this thing since March, and we really want to put a timeline for them to push that thing. I know they say that they're going to roll out to the end of this month, and they do better tests right now to make sure that it's working and all that kind of stuff. But the SARA Alert is a web-based program that the people doing the 7 days quarantine can sign up, and public health can actually verify the address, the phone number, so they have a firm data on the person that they send home from Q Factor. Right now, sometimes people put their phone number there that is not reachable, or the address is not their address. So with this thing on board, at least public health know exactly where you are. You have the right phone number, your right address, and this alert will make you report, your vital sign, your symptom, 2-3 times a day for monitoring. But like I say, if PAC don't put a timeline, I'm not sure when we're going to roll it out. So we keep push for a timeline for them. So we really want to see if we can implement this thing the first week of October. But people need to go home earlier.
Right.
Saipan did it. It worked well for them.
Yeah.
So, we have to jump on board and move. I think that if anything I learned is that if you don't put a timeline, it's not going to happen. So we want a timeline on this.
Did you guys chew out public health and say, hey, why aren't you guys doing the thing with the court that you were doing before that made the quarantine okay? Because now we're all exposed, and now we got to open the quarantine jail and set everyone free because public health couldn't do their paperwork.
No. I think bottom line, when you really read it, the judge didn't say that she's not agree with the 14 days quarantine. It's just I don't know, legally or they didn't do the
They didn't
legal
do their
thing.
paperwork.
I guess
Yeah.
the paperwork not correct. She didn't dispute the 14 days. The 14 days, she didn't dispute that, but she disputed the way they approaching the paperwork.
Right.
And that's the legal side that I'm a physician. I don't know.
Well,
I
you
just
know
worry
about paperwork, though, as a doctor, I'm pretty sure.
Yeah. We have to do the paperwork on our physician side that legal. So so I think they just have to change the way they make people sign or tell people to do certain thing, and so it's a different way. So I don't think that she say that 14 days not
right.
It's not appropriate. So.
But now you guys are looking at changing the whole thing back to the 7-day test out, right?
Yeah, I think that it's nice. Chris Sabrina sent people home early. 7-day testing out, and we also push for the testing at the airport also on the day arrival. So that way we have 2 tests before we send you home. You catch 90+% of everyone that's positive before you send them home. So, and plus with the SARA Alert on board, the patient can monitor the symptom. When they go home on the 7 days, it doesn't mean that they are free to travel everywhere. They still have to be home quarantined for the next 7 days with SARA Alert on. So people need to aware that once you get home, they're not free. They still have 7 days at least to be at home.
Doc, did you have any info at all about the 10-year-old boy, Naval Hospital? I've been really trying to ask around a lot of different people. Haven't really heard a lot. Did you guys discuss that last night in the PAG?
Yeah, well, the Christian, that's really we can't get anything out either. I tell you, kids at that age, they don't have that many problems we do. They don't have a heart attack. They don't have kidney failure. The only thing we can figure out is really the 2 most common comorbidity to a kid are either they diabetic, or they have asthma. That's the odds. The child probably have either one or the other. But it's kind of important for the physician to know if they release it, because the pediatrician need to kind of watch out for that type of chronic illness if the child really have it. it helped the physician community how to manage the children that have comorbidity, and maybe if they have asthma, we have to kind of to monitor and treat the asthma more aggressively in children. So it's important for them to know that. But I think they're going to try to get some information out somehow. But again, it's HIPAA, so the family have to release that somehow. It will help the physician and community to manage the children with the comorbidity like asthma, if that's the case.
Right.
Doc, what about discussions about businesses? I know we kind of touched on it really briefly last time we spoke. You mentioned they were going to be possibly talking about it during the meeting.
We opened that up and no one come up the list yet.
Day.
So the only thing that we really want to push is, when I tell you I hate to park in the curbside and have them bring the food out. We want to be able to walk in the restaurant, make the order, and then go out in your car and sit there and bring it out to you. It's nice to walk in and look at the menu. So I think it's very safe. Everyone agree that it's safe for us to walk in, make the order, and come out and sit down in your car rather than order online. I don't know. I feel like I'm really ordering food in a restaurant. So
got to be positive about it, Doc. I mean, you pull up, you sit there, it's like, hey, you're totally getting catered to here. I will take my acai, please.
And a lot of people want to play golf. I'm not quite sure.
I know a few people want to play golf.
There's a thing called virtual golf,
Right.
EA Sports.
So that's.
So, Doc,
but
I mean,
think that business-wise, we have to do very slow, guys.
Right.
Truly very slow.
And we get it. So, in talking to you last week, it kind of seemed like the doctors had their homework in the PAG, which is come up with a list of businesses or types of businesses that you guys think we could reopen safely during this peak or one lockdown. It kind of sounds like either they didn't do their homework or other more pressing matters like the actual virus response and dealing with the virus took center stage in the meeting. Is that a correct assessment, Doc?
Yeah, there's just other stuff that we talk about. So, but the business one, we do want to open, and everyone put that 2 cent worth in there. But we all agree that we have to do it very slowly. So, again, we just try to help the restaurant at this point and stay open and stay alive. And the other business will follow as this coming week here to see how the hospital will handle this. And we talked about the hospital. Both hospitals had to kind of work with each other, and it's no longer GMH or GMC. They need to function as one, really, because we have one island, so they need to share resource somehow to make the care better for the patient.
Doc, there have been I guess criticisms and concerns from people about these PAG meetings and them not being open to the public. Do you guys plan to ever let the public be allowed to participate or watch or listen in, or maybe even just once a month allow the community to provide comments so there's this dialogue and maybe even ideas that you guys can...
So Sabrina, I mean, when we put together a PAC, we all agree that sometime when we it's not the purpose to close the PAC for no public, anything like that. We really, when doing the PAC, we really discuss things very freely. There's no, we have different opinions, we have different ideas, we have some crazy ideas, we have some very safe ideas, but we speak very freely during the PAC. Remember, the PAC is a group of volunteers. We volunteer our time and we try to give the advice to the government as best as possible. And it consists of all kind of pharmacists, dentists, physicians, different clinic, and we really speak really, really freely. And and what we do, we have another chat group on a provider that we kind of update them apparently what we talk with the PAC, and they give us idea, and we take those ideas back to the PAC, and we talk about it. Do we keep memo on the PAC? No. I mean, I have a secretary that do the minutes, so that way I remember what to do. But it's not really not sure legally it's official group, because we really all volunteer. We don't get paid a single penny on this thing. All of us spend a lot of time, our free time, cancel my clinic, and I want to do that. Sometimes we invite a physician from the community to come in and to Zoom in and give the opinion. Okay, but I'm not sure if to open out or keep everything officially, like official group, that will kind of prevent the physician from speak freely on certain subject to try to move things forward. Sometimes we bash the government official because they don't do the right thing.
Yeah.
But I'm not sure that will be beneficial in the community. That we bashing somebody.
Oh, they would love it. The community would love it if they heard you guys bashing on people.
Chris, that's not the thing. We just want to speak freely how we feel, right?
Yeah.
Because, but all we want to do is move our community forward on this pandemic in a safe way. So, I don't know what the right thing. I'm not in the politics. I'm just a physician.
Let me ask you this then, Doc. What if the governor said, "Oh, we got to be transparent now, guys. We're gonna carry these PAG meetings on the governor's Facebook page. We're gonna live stream it." Would you still be in the PAG?
If we have to do that, we have to do that. But again, the physician and the member probably will not be so open and not be to speak freely on their thoughts. So I don't know. Either way, we do whichever way that the governor want. I said, again, you gotta understand, it's a group of volunteers, and the governor have a choice to listen to us or not. She make the final recommendation. Again, she really none of us benefit anything from it, except that we all have our heart to move the community forward. It's a lot of time, guys. It's a huge amount of time that we spend there, and it's just like I say, all volunteer. I just lost one physician, and I have a very hard time finding a person that want to spend the time away from the clinic, the family, to sit on those boards. It usually take 2 hours twice a week, and then we spend more time on the side talking.
I did have one more question, and it goes back to that 20 to 4-year-old demographic, and when you had asked, what else, right? We can do about this. So, to me, is this just kind of an admittance that this whole stay-at-home order hasn't been working over the past month? That we can't get these 20 to 4-year-olds to do whatever it is that apparently it doesn't appear like they're sticking to the stay-at-home order, since we're still seeing these positives. And if in fact that's the case, do you see the PCOR 1 restrictions being even more, or do they need to be more stringent? Do we need to have roadblocks? Do we need to have a curfew?
Sabrina, that's the $1 million question. It's a thing is that we, I think we need to do some better education for that group, the 24 years old. I mean, we just need to educate them, put something out, on the PSA, something. We got to approach it a different way, because whatever we do right now, it doesn't work for that group. Everyone get the message. I tell you, the comorbidity, people with comorbidity, they know it. They stay home. That's not the problem. We need to somehow approach this 20 to 40 years old in a different way in order to carry the message across to them. Right now, yes, I agree with you. The stay-home order right now that doesn't work with them for whatever reason is, but we have to take a look at that and see what happened. But like I said, if anyone have any idea, let us know. You guys let us know how to approach this special group of people in 2040 and and tell them, hey guys, be different, be respectful and be patient, and respect people around you and care for your family somehow. But if you guys come up with the idea, let us know. We open for suggestion on that one. But that special group really have to be very careful. To again, if you're 20 to 40 years old, you really have to pay attention because everything go up and stay up. Just because we're missing something in that group.
Right. Doc, I'm totally here for you guys. Give me the Zoom link for Thursday's PAG meeting, and I'll jump in and I'll give you some ideas for how to market.
Okay, Chris. We'll keep that
between us. So keep it between us, okay? I'll just be lurking in the dark. Okay.
Okay, guys.
All right.
That's it. Just be safe and stay home, guys, and learn to appreciate things that we have. Okay.
Thank you, Doc.
Thank you.
Takeaways from Dr. Ho. We'll see you.
Thanks.
Wash your hands.
Thanks, Dr. Ho.
Takeaways. He seems to think that we're going to see an extension of the PCOR 1 lockdown.
Mm-hmm. Yeah. So that could mean some changes to the in-office voting. We'll check back with Maria if, in fact, this PCOR 1 stay-home order is extended. We just have to wait to see if the governor. I don't know. We'll hold a press conference.
We had a comment here. Mixed messages aren't helping. You mean like when they allow construction, ban construction, then allow construction? One of the key triggers to move us from PCOR 1 to PCOR 2, and these are the government of Guam's own triggers. There's hospitalizations, there's contact tracing, and there's the ability for the Department of Public Health and Social Services and the government of Guam to conduct community mass testing. That's one of the triggers.
And then the positivity.
And then the positivity rate. So...
But they are looking to change that from what Dr. Cabrera mentioned.
Right. So we'll try and get Dr. Cabrera on maybe tomorrow to talk about that. But when we talk about community mass testing, people are really grumbling about this. And I don't know if public health can appreciate that. But we're doing this community testing in Umatic. We want to bring on Umatic Mayor Johnny Canat. Good morning, Mayor.
Hi, Mayor.
Good morning, Chris and Sabrina.
Good morning.
Thank you for having me.
Of course, Mayor. So let's just start at the beginning. They're doing a community mass testing in the village of Umatic. This was a mass testing that was supposed to take place when?
September 19th.
No, when was it? It's rescheduled from a previous community mass testing.
It was rescheduled somewhere in, I think, August. Somewhere in August.
Right. And then was this because of the rain? Remember there was a...
Yes.
Right? Okay.
Because of the rain, and they said it was going to rain hard and stuff like that, so they canceled it and they moved it to September 19th.
Right. And so now that we're doing it on September 19th, I'm assuming a lot of people in Umatic want to get tested for COVID-19 because, they had that one schedule that got canceled, but now we're hearing that it's going to be limited to just 200 people. First question, Mayor, 200 slots for community mass testing in the village of Umatic. Is that enough for you?
No. I already have 122 already scheduled. For pre-testing already. I have 122, and their phone keeps ringing left to right. We have people from the outside that are calling in, but we wanted to have my people tested first. And then Friday, we're going to call up the people that are calling in. We're keeping their names so we can call them so they can get tested before Saturday.
So you're already at 122 by Friday.
We already have 122.
By Friday, how many people do you think you'll be maxed out, you think?
I was hoping, that people come out and get tested so we can know where we're at right now. Right now, that 1 to 4, we're not safe like that because, they're not telling us who they are and what. And it's personal, private for us to know. So we just have to stay home. And the people at Umatic are doing a good job by staying home.
How frustrated are your residents, though, when they know that the spots are limited and you got to register by email? I mean, do you guys all have email down there in Umatic?
By email?
Yes, we do.
Yeah,
We
that's
do.
what they're.
Jenna's picking up phone calls right now since yesterday.
Yeah. So how can people register? We'll just ask you that, Mayor.
Excuse me?
How can people register with your office? Because we do have public health coming up right after you.
You call 828-8251.
All right.
We're trying to keep it one number so that Jenna's the only one that's answering it right now because we need the other line for the other people, whoever, for in case something happens in the village, we need that other number.
Right.
But for the testing is the 828-8251. As we speak, I can still hear the phone ringing.
Right. And then we also had got a release from public health that said you can register via email. Did you get that?
From public health?
Yeah.
Probably, but
Yeah.
I just read the phone number. It's easier.
Yeah. So we'll ask public health how many people, because I mean they had one in Talafolfo and it was like filled up practically in the same day.
I heard the mayor wanted to test his people too, so that's what I wanted to do, test my people too, so I'll know where we're at.
What's the cutoff for
safe down here.
what's the cutoff you're gonna give to Umatic residents before you open it up?
They said there's 200, so I'm just gonna go. Whoever calls in before Friday, before the testing, and nobody else called before Friday, then we're gonna give the other people to come in and get tested for that.
I see. So you're already
Jenna
kind
is
of
already setting it, writing the names down, the people that are calling in.
like a
She
waiting
got a
list.
and we're waiting for the people. We're giving them till Friday, and when Friday comes, Jenna's gonna start calling those people up to come in for testing.
Okay.
But right now, we're concentrating on the people of Umatic.
All right. Thanks, Mayor.
Anything else you want to add here, Mayor, for your constituents?
Yes, I just want them to stay home, keep safe, and just keep the family home. Don't go anywhere. If you're gonna go out to get essential stuff, wear your mask. Bring your hand cleaners with you whenever you go in and out. Clean your hands. And that's it. Thank you.
What can you tell us about positives in the village of Umatic?
I was surprised. Because in the beginning of this COVID, they were saying that Umatic had one, so I had to call the president of the mayor's council to find out, is there any way that we can know who have it so that, you don't know we're hanging around, because we're family down here and we all hang around together. We don't want to hang out with somebody that has it and then we don't know. See, that's the problem, is us not knowing who have it. And then we are sitting down, talking and hanging out with them, and they pass it to us, and then we keep passing it. So the thing is, I know it's a private thing, but we need to know so that we can. It's not that we don't like that person; we just want to keep away so we don't pass it to our people down here.
Mm-hmm.
That's my concern.
Let me ask.
So the mayor, go ahead.
I was going to ask then, have you asked your constituents then to download the Guam COVID Alert app?
I'll see what I can do. It's just that I'm always thinking about the safety of the people, and it concerns me because mayors are calling me. It's been 5 months. You just have this 1 to 4. I don't. But it's sometimes it's just when you go out and you come back from anywhere, shopping or getting stuff from downtown, or I'm not saying, anybody, you just can catch it anywhere you go. Sometimes you're gonna miss something, That's the problem with this disease, and it's never gonna stop until there's a cure.
Right. Mayor, do you feel insulted at all that, when it comes to the South, you had a testing, they postponed it. Now we're getting testing. It's just 200 slots.
Yeah, of course. I don't have only 200 people. I got about 1,000 down here. Of course, it's sad. It's because we only have 200 getting tested. And what if there are 200 and there's still more to test? But I urge the people of Umatic to come out and test, because it's the only time that we're gonna get tested. We have to wait again. So I urge the people of Umatic to come out.
Did you ask public health why only 200? Or for more?
Actually, Jenna and public health are the one that are talking with that, because I'm too busy trying to keep things going down here. So she's the one that I let her handle that, because she's good with
The computer.
Yes.
Right.
Chris, you know me.
I know you, Mayor. I know you.
Yes.
Jenna is your AA, right? Just so you guys.
Yes.
Yeah.
She's a good AA. She's very up. Both of them are good. Diane too. My secretary. They're both great workers for me.
Thank you, Mayor.
Thank you, and have a good day.
Okay.
You too. Take
Thank
care.
you. Right on. And we'll just go ahead. Father Paul, I see you there. We're just going to get with public health just super quick, and then we'll get to Father Paul Guffigan, who, jumped on. Thank you, Father, for I know it was last second, right? Good morning. And so we'll go to the Zoom room. We'll keep it in the Zoom room, and I'll bring on from the Department of Public Health and Social Services. She's the PIO. Janela Carrera. She's joined by Vince Munoz, who is Janela. Refresh my memory again. Sorry.
Path check.
My
check.
title?
Yeah, Vince is he with public health?
No.
This is a path check developer.
Right. Okay.
Yeah.
Well, yeah, actually, Vince.
Oh,
good
sorry,
morning.
yeah.
Yeah, Vince. Good morning, is Jason. I can actually vouch for Vince's computer savvy. He's actually been working with GovGuam systems development for a very, very long time. So Vince, to have your
You got drool, Jay. You got some drool.
yeah,
down there.
so Vince, to have your experience on this project and everything is greatly appreciated.
All right.
Thank you.
Thank you. Cool. I like your Britney Spears headset. I want to get one of those. Janela, we just start with the mayor's concerns. I know that we had talked about this in Talafofo. This had been an issue before you came on with the backlog, but the thinking is right that you guys just can't handle more than 200 tests in a day.
So we shifted our focus again to targeted testing, and that's pretty much the consensus for limiting it to 200 tests for our community outreach. We had that huge test, the people that showed up back in August. And we didn't want a repeat of what happened back in August, where we had that huge turnout, and it caused a backlog and then delays in, relaying results to residents. And so we wanted to focus more on targeted testing to high-risk groups, and so that's actually what we've been doing. So we haven't stopped targeted testing and outreaches. It just so happens that it's not in a community-wide setting, in a mass testing setting. And so what we're doing is with the community testing, for example, with Talafofo, and also with the UMATIC Mayor's Office, it's just sort of in batches. And then also we're continuing to do testing at our northern clinic, our northern regional community health center.
Janela, so where the mayor said he's already up to 122, and then I saw in the release, I think that was from you guys, that there's also an email. So are we already maxed out with the 200? How many more slots do we have? What's the status on that?
I'm not sure where you got the email information. I don't believe we are taking registration via email. I don't think we issued that in the JIC release. I was looking through our JIC release, and I don't see that anywhere that we're taking registrations via email. We're taking registrations via telephone through the UMATIC Mayor's Office, but not via email. We did put in the JIC release that you can receive your results via email, but not registration via email. Mm-hmm. So just wanted to make that point.
Where did the 200 cap come from? I mean, how was that determined that 200 was the max that you guys were going to do testing? I'm just curious.
I think it's a manageable number at this point. We wanted to ensure that based on that number, we wanted to make it a manageable number. So I think 200 at this point, when we bring in, when we ask people to register, it is a manageable number that we can start off with. And so that's the number that our Department of Public Health is using right now as a manageable number to start with.
Okay. So we brought you guys on here because you guys wanted to talk about the Guam COVID Alert app. How have I guess the downloads been going since the press conference? Was it a week ago? I think.
Just a little under a week ago, we launched last Thursday. I think Vince probably can answer that best as far as monitoring the downloads so far. So I'll have Vince answer that question.
Yeah, we've had over 10,000 downloads since the launch. I think when our outreach, our marketing plan gradually kicks into gear, we hope that our numbers go up. I mean, there's a reason and there are goals on what we're trying to achieve. But, that's a good number considering this is mostly grassroots. There was very little done in the way, of advertising and all of that. But we are, Janela and Monica Guzman, who lead that effort, can probably talk a little bit more about that if they like.
And if we could just talk about why it's important for people to download this app.
Sure. So, and Vince has talked about this as well. When people download an app on their phone, whether it's for social media or games, educational purposes, typically when they download an app, it's meant for the user. You download an app that's meant for your personal use. It's meant to benefit yourself. Facebook, Instagram, those beauty apps, whatnot, educational purposes. You download it for personal use. This app is different. When you download the Guam COVID Alert app, an exposure notification app, a contact tracing app, you're really downloading it to benefit the public. You're downloading it because you're contributing to something that's greater than yourself. You're downloading it to benefit a community, to benefit your friends, your family, people that you may never even meet. So I think that's really the ingenuity behind this app, is that you're contributing to something that will save a life, that will protect people, that will prevent infections. And so I think that's really the difference between this app and the apps that we're so used to using on our phones. And on top of that, when you download this app, you hardly ever really interact with it. The only time you interact with it is if you test positive and you choose to enter that report into the app, or if you get an alert that you may have been exposed to somebody. Other apps that you use, like Facebook, you're on it constantly. If you want to read the news, you're on it constantly. Instagram, you're on it constantly. So this app, you hardly ever interact with it, and yet you're still contributing to something that's really greater in the long run, that benefits people. So I think that's really the difference between this and other types of app. And that's why it's a great app to use, because you're helping people, you're helping your community.
Janela, I hear people talking, and one of the things they bring up with the app is the privacy concern, right? And I know that you guys really addressed at length that issue during the press conference. But if you could, again, for those people, I just heard it last night. Oh, you download the app, they're going to track you. They're going to know who you're going to vote for, this and that. So if you could just maybe address, and maybe Vince, you as the technical guy, is it real? The privacy concerns, is it real?
It's really interesting when people are really concerned about privacy. When they talk about the privacy concerns with the Guam COVID Alert app, and yet sometimes they don't realize that when they use Facebook, Instagram, Facebook has less privacy when it comes to using the app, and even other apps. You know, there's less privacy even when you're using your banking app. And this app has a lot more privacy. You can turn off your location services, and this app will still, will still run even in the background. And I'll let Vince talk a little bit more about privacy. You know, he's more the tech guy and was part of the developer team when this app was being engineered.
Yeah, I think, I think anybody in the tech world knows the most interesting thing about this app was it was a joint effort with Apple and Google, two big, obviously in the smartphone mobile world, they're the biggest competitors, but they came together for this. And because they were building an app that was going to do exposure notification, there was no question that privacy, they knew at the forefront, was going to be a concern, and they were going to get heavily scrutinized. Even the ACLU, who's an extreme watchdog for privacy, reviewed this, and they felt that it mitigated the worst privacy concerns. So as we were developing the app, this was unusual, unlike any other app we've ever done. Every single step was meticulously reviewed. Normally, when you submit an app, you get, you submit, you go into like a flight test, maybe beta, and then you go one last time and it gets out. This was not like that at all, and this is very unique. You can only implement one app per jurisdiction. That meaning one app in California, and one app on Guam, and one app in most countries. And we are the first territory. We've beaten many countries. We probably could have been the first in the U.S. if we really wanted to.
Yeah.
So
I think you guys got to have a better sell than, oh, you're already giving your info on the Facebook.
Yeah.
I mean,
Yeah,
that's kind of, oh, you guys are TikTok already.
We'll see. Well, Vince, on that note, I was hoping you can really emphasize like what I kind of see as a tech guy as the main advantage of this, because we talk so much about altruism and taking care of our communities and our neighborhood and our family and our island, and in Napa Malik, this app, because of the network effects and the more people that use it, the more valuable it becomes to our health and well-being, is really a digital expression of Napa Malik, correct?
It's quarantine management. I mean, you think about it, when the epidemic gets at the level that we are, and I think we're the top per capita infectious number of infections, something to that effect. I wish Dr. Thane, by the way, was here and the rest of the team, but yeah, it's quarantine management. How do you find a way to say those of you that that potentially could have be infected, because 50% of the spread of this disease happens during the asymptomatic phase. So you have no idea. And how's a contact tracer going to find somebody if a person that tests positive that they investigate says, well, I was in a market, or, I was at a gathering, I don't know everybody there. It's impossible. So that's really what this does. It does quarantine management. And it allows us to set aside those who can say, hey, I may have been exposed. Let me set a few days. It allows public health to throttle that, to be able to give them an assessment to this, to help them determine when they should come in for testing and when, they should just stay at home. Sorts of things.
Can you guys just really quickly and just in simplest terms explain just how this works? You sign up for the app, and then if you test positive, you go into the app and say I tested positive, and then it just lets everybody else know? Can you kind of explain this in just non-technical terms?
You want to do that, Janana?
Sure. So if you have the app downloaded to your phone, and say, for example, you test positive, somebody from public health, a public health official or a trace investigator will contact you, let you know that you've been diagnosed positive with COVID-19. They'll ask you if you have the app downloaded to your phone. If you tell them, yes, I have it, they'll ask you if you want to enter that positive diagnosis onto the app. And if you say yes, they'll let you know, okay, so I have a code ready for you to enter. That code only lasts for 15 minutes, and that's for security reasons. If you're ready, then they'll give you the randomized code, and then you'll enter that code into the app. Once you enter the code, the app itself will say, thank you for keeping your community safe. Then you're done. That's all you do. That code will go out into a server. It's a Bluetooth beacons that will alert any person who's been in contact with you for the last 14 days through their phone. No personal information is ever shared, so you don't know who's been in contact with you, and those people don't know who this person is either. And that alert will go out, and when they get that alert through their phone, and it'll say, you may have been exposed to somebody within the last 14 days who tested positive. You open up your phone, and it'll give you recommendations and what to do next. They're called next steps. Those recommendations will tell you, check yourself for any symptoms, such as, A, B, and C. And if you do develop symptoms, here are some phone numbers to call to our clinic and any of our clinic partners. And then it'll also give you a GMA directory for all other clinics, whether they're partners or not, that you can contact.
Thank you.
And then if you do develop symptoms, sorry, go ahead.
No, go ahead.
If you do develop symptoms, then you can also schedule for an appointment to get tested.
Thank you. Let me just break in here real quick, Janelle. It's 8:04 to our viewers on KUAM TV. Thank you guys so much. Let's go, Fen, jump over to our KUAM News Facebook Live feed, where you can Bluetooth with the TV and you put it up on for everyone to watch. You know what I mean? Or right here on the radio. Do it the old-fashioned way, man. Tried and true. The Breeze, KUAM FM. Gotnya, we're 93.9. Good morning, 8:04. Hi, KUAM TV. Bye, KUAM TV. We're back in it with Janella from Public Health. Janella, it's so backed up, but I just had a couple questions. First, if you could, there was that statement that came out of the Speaker's office about possible furlough of 80 employees at Public Health. We didn't get anything official from the agency or Adelup, but can you tell us anything about that?
So, right now, I think, we're working with BBMR. They're the fiscal team that's going to be reviewing all possible angles. There's really nothing much that I can say as far as, the budget. I really could not tell you much more. I'd rather defer to BBMR and our fiscal team at Adelup. We're going to review it. At all costs, as much as possible, we're going to avoid cutting personnel, but and work within our means for our budget. But I'll defer to BBMR, and I'm sure that our department is working with them to review the budget and all options possible.
So, was Public Health not aware? That it was not on their radar? That the potential for these 80 furloughs was real or was there? And because, this budget was passed, August 31st or something like that, I would have thought that, the public health director or somebody would have been shouting from the rooftops that, hey, we've got 80 furloughs that are possible if we don't get, if the governor's budget doesn't pass.
I know that Director Artson Augustine has always been in constant communication, constant contact with Adelup, with BBMR, with the governor's office, constantly reviewing the budget, constantly communicating as far as what all possibilities are. I know that he was very busy in the last couple of weeks, few days, especially as the budget discussions drew closer and closer. But again, as far as the budget is concerned, as far as any potential furloughs or potential layoffs are concerned, I'd rather give Art that that discussion, that floor, and Bibi Amara as well.
Are you okay?
Yeah, I wanted to go back to the app, but did you have something
Yeah, I
else?
just wanted to ask about I got a call from one of my old neighbors in Iran. Janella, what can you tell us about the Southern Public Health Center? Guy called and he was pretty irate. He said it's been closed. They don't want to have to go up to the northern one. So what is going on again with the Southern Public Health Center?
It is still closed. There were some issues that we were having with the air conditioning unit there, with the facilities there. And I know last time we had discussions on it, we were waiting for some parts. I believe that they had arrived, and we were working to fix the issue, but I think that inspections were still being conducted. I think we're pretty close to getting it fixed and up and running. It's just a matter of ensuring that the AC is running and inspections are done. So hopefully we will get it back up and running pretty soon and able to open it so that we can use that and open it up for the public.
I've heard instances in which people have been contacted by public health that, they tested positive for COVID, but then they were informed that that there was a mistake that was made, that they're actually not positive. Do you guys keep track of that? Do you have any numbers regarding that, where mistakes like that were made?
I'm not too familiar, regarding that, but if that is the case, so you're saying positive, but later was not positive?
Right, that
I'd have to
public
look
health had
into
made a
that.
mistake, that they had notified individuals that they were positive, and then oh my bad, sorry.
False positive.
Right. Have you heard of any instances of that? Do you guys keep stats on that? Do you guys look into things like that? Have you received complaints about that?
I'm not too familiar with that. I have to look into that.
Okay. So if say that does happen, how do you take that back? Like, you give somebody the code and it's like you're positive, and then you input the code, and then later on a phone call comes in and it's like, oh, sorry, you're not really positive. What do you do? What does this app do?
Well, in that instance, if that is the case, if that is in fact the case, of course, we would have to investigate it completely. But again, I'm not aware of something like that occurring.
No, I'm just saying
I'd have to look into that.
If somebody is given this code, right? Public health gives the code to the person that tests positive, and then that person inputs the code into the app. What happens if public health calls that individual and says, I'm sorry, but you're not actually positive?
How do you uninput
Yeah,
it?
what do you do?
You reverse hack it? Vince?
That's a good question.
That's why she asked it.
And the challenge is the privacy preserving, architect of this app makes that really difficult, because once we upload keys, we have no idea who that is. I mean, Apple and Google designed it that way. It was intentionally designed that way. The only way for us to do that is to put it in sort of a log. So that is something we are exploring. We are talking, about. But the Google Apple exposure notification protocol has only been issued, I want to say 5 weeks now, for the first installation in the U.S., which was in Virginia. Prior to that, it was the Swiss who really started this venture, and the Germans and the Irish. And so there are other things that would be, that would make the app run better. But the problem is, because of the privacy preserving, like you can't capture GPS locations. Right. You can't use your camera while the app is up. So there's no way to get around that, One thing I do want to mention, though, about the app, that for Guam, aside from the benefits we get from quarantine management, aside from the fact that, this is really not, those are concerned about privacy. This is actually empowering to the user. The user actually has the opportunity to do something about COVID. So I wanted to make sure that they understood that. But if we achieve an adoption rate of over 38%, we will be the biggest story in COVID tracking in the world.
Wow.
Google will make sure everybody in the world knows about this.
Are we going to get money for it?
Well, it'll probably brand us as the safest community in the world. We'll be like New Zealand, except even better, because who's the biggest marketing company in the world? It's going to be Google, Apple. And this is their protocol. And I would say that the benefits that are there actually also come in other ways. Like, for example, there's an Institute for Technology and Global Health that reached out to us now to help do some research on adoption rate, not just for what's happening here, but to look at it from a broader perspective so that other states, other countries that start to implement this will have some info and some guidelines, some lessons that they can learn from that. And we're taking this opportunity to work with the university, have our university be part of that research effort. And, most of these people that are doing this institute is born out of people from Harvard. So it really kind of, allows us to contribute in so many ways. If we beat that rate, we're going to really help the world learn how to beat and manage the COVID infection rate.
Thank you. Thank you.
Yeah, and if I can add to that, we can set an example, as Guam being, as Vince had mentioned, as he pointed out, we set an example to others. If we beat that rate, they'll look to Guam and they'll ask, how did Guam beat that rate? And they'll use our method and use it in their jurisdictions. So we have an opportunity to help other jurisdictions as well. I think that's also important to show them that, because we're a tight-knit community, we're a small community, and so we have this unique opportunity to use this app not only to help ourselves, our community, our people, but to also help other jurisdictions beat COVID-19.
Last question, Bree.
I know it's maybe it is too soon. It's been live for about a week. Have you guys noticed anything that maybe you should tweak, or were there any bugs or anything like that, Vince? Or everything seems to be running smoothly?
I think probably the biggest thing sometimes is people's font. When they have this huge font and the screen comes on, you have to scroll down because that kind of blows up. But other than that, it's been pretty good. I think our biggest concern, I would say, Janella, right, and everyone, is people's concern about privacy, and the only thing that I can say, it's been very scrutinized. The ACLU has looked at this. Many people have looked at this, and I understand their concerns. But the only way to be able to put out an app where you're sharing something about your exposure or the exposure of yourself to the COVID virus is you're going to have to share information, and you're going to have to trust. And you're going to have to trust that the people at Google and Apple and the app developers and MIT and everyone else that's involved in this and the government is protecting your privacy. This is a really hard app to do. If I did this as a local company myself, I'd have no shot. They would never trust me. It really requires a lot of different people to come together at a different level. So I hope people understand how this is, like they said, is really about protecting others. And and hopefully this community comes together.
Yeah, and if I can just add that, the purpose of this app is really to aid our contact tracers, aid public health, in quarantine management. We want to use it as a tool to end lockdowns, to end quarantine, to contain the spread of COVID-19 in our community. It's not to track people's movements, to track locations, to find out where people are. Our goal is really to contain the spread of COVID-19. We want COVID-19, out of this community as much as anybody else. We want to end lockdowns as much as anybody else. We want to stop quarantine as much as anybody else. And this is one of the tools, in our toolkit. So we're looking at all possible resources to do that, and this is one of them. And whatever we can do, we've been speaking with doctors, nurses, whatever we can do to help them, contact tracers. They're overworked, they're overwhelmed, and we really want to help them, and this is one of the ways that we can do that. Guam COVID Alert, it's really meant to help the community contain that spread, and really just want to encourage the community to download this app. We're not doing this to track movement. It's really just so that we can, find out the numbers, help contact tracers, especially with those that we're unable to reach. And so just really can't emphasize enough to encourage the community to download this app.
All right. Well, we thank you guys for your time. We've got to move our show along. We really appreciate everything you guys are doing. So thanks a lot, Janella. Vince, thank you so much.
Thank you, Vince. Maybe next time you can play a little number for us on the piano. Sorry, I just see a piano I want to play.
My daughter's actually.
Okay.
Stay safe, guys.
Janella, thank you. And you're right. I went back and I think I saw the phone number for the Umatilla Mayor's office, and I did see that there was an email that if you get tested, you want to get your results via email, right? So thank you for clarifying that.
Not a problem. Thanks, Chris.
Okay,
Thanks,
we'll see you guys. See you, Vince. See you, Janella. We got to take a really quick break. We were slated to get Superintendent John Fernandez on, but with so much backup, we're jumping him to tomorrow, Jay. Okay, calling an audible. So we're going to take a short break, and we're going to come back with 3 senators from the Guam legislature to talk about just a bunch of stuff. Furloughs, not furloughs. I don't know. What did that even... We asked Janella about the furloughs. What was the response there? Yeah. So we'll find. We'll talk.
She deferred to BBMR.
Right. Yeah. So 8:20. We'll take a short break again. It's the link on the breeze. 93.9. Good morning, Guam.
The GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
Hafa Day, my name is Zena Cruz Vecina, a registered nurse with the Department of Public Health and Social Services. COVID-19 continues to be a very real threat to Guam. Wearing an appropriate cloth face covering in public is a simple and important way you can protect yourself and others on our island. During a pandemic, no single action will stop the spread of the virus. Wash your hands often with soap and water and stay 6 feet away from others. Prevention saves lives. For more information, please call 311 or check out our website at www.dphss.guam.gov.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
Downloading the app on his phone. Download the app. Download it. Do download.
They got 10,000.
Only that. Oh. Okay. So, do you guys download the app yet?
I did.
Okay. 825, it's the Lake on the Breeze, 93.9.
Senator Kelly, wait, show that again, Senator Kelly.
Hold on, yeah. We're going to pull up the KUM News Zoom room here.
Yeah, she's running it. Nice.
She's active, yes. Senator Kelly Marsh Taitano. We have our legislative health chair, Senator Therese Terlahi, and the minority leader, Senator Tello Taitagui. Good morning, senators.
Good morning.
Good morning.
Thanks for joining us. Let's just get right into it, and we'll just start with Senator Therese. Your reaction here. We tried to get a little bit to the bottom of this whole issue with the furloughs. We had, I don't know if you guys saw, we had Robert Koss on from the Guam Federation of Teachers to kind of get into if we are going to have furloughs, because the F word was dropped yesterday in a release from the speaker. We asked Koss, what's the process? And it does sound like, for the classified employees, it's a rather long process, which is good because it's designed to protect them. But it seems like the unclassifieds can get the boot a whole lot quicker. But when we asked Janella Carrera, the spokesperson of public health, about the furloughs, she deferred to BBMR, which I thought was interesting because I feel like if there's going to be 80 furloughs at public health, then probably, maybe, call me crazy, public health might have something to say about it. Is that crazy? It's kind of crazy.
Yeah. So are there going to be furloughs or not? And maybe even just take us back, because when this all, after the budget bill was overridden, there was a release from the speaker. There was also this video that was sent in the chat of a portion of the discussion on session floor where the speaker had mentioned it and Lester had responded. Can you guys just what's going on?
Yeah, Senator Therese, go ahead and we'll just start with you. What do you know about these furloughs? Is it real?
Good morning, everyone, and thanks for asking us about this. First of all, you know, a furlough is a choice. It's the governor's choice to furlough, and I think it's a very I don't know. I would say anxiety-causing news release to say that's the first choice that we are going to make right now, when we are all facing the same, you know, cut in revenue. We're all trying to deal with it, and the first choice to make is going to be a furlough. I can't see that. I think if there's anything that's going to cause anxiety for the community, that's it, especially public health. And like Robert Cost said, there are rules for furlough. There are priorities. There are agencies that are priorities, you would think, in the government of Guam. And that this announcement that furloughs at public health are the only choice that we can make right now, I just think that's reckless and irresponsible. First of all, the OFB told us the budget covers all personnel. That's one. And then I talked to public health. And because we know that there were significant cuts to public health, but we asked them, will there be furloughs? And they were very clear. No, we've worked it out. We're not going to furlough anyone. And that was the director's decision. Of course, BBMR is saying now, you know, maybe it's their decision. We'll see. But it reminds me of the time when, you know, we were facing the Trump tax cuts to our revenues. And, you know, they decided back then, well, why don't we, threaten the legislature with cutting police stations and fire stations first, before cutting a single person at Adelup, before cutting any other type of employee or any other cost of the government of Guam. We're going to cut a police station, a fire station, and now a public health. I find that to be irresponsible, and it needs to stop. You know, we're all trying to work together with this crisis that we are in, and that's what we need to just stay focused on and stop making threats or, you know, really causing panic. And I really feel for the employees at public health. Why should they be in the middle of something like that? It's not even necessary. It's not necessary.
Senator Tello?
Well, I think you're absolutely right. I share the same sentiment as Senator Tlahi, you know, putting out these threats. I think, to me, bluntly, straight to the point, and I've always been that kind of person, that I think she just wanted to find an excuse why she voted no on the override. Maybe she...
Sorry, that was...
It's true. You know, I mean, I can't think of anything else, because she had every opportunity. When we spent weeks, 10 hours a day on the budget to find ways to assist public health. And if I'm not mistaken, there was an amendment that several of us supported, but not enough of us supported, where Senator Tlahi provided more funding for public health. And I don't think she supported that. We can look at the record. She didn't vote on that. And then now she's calling, you know, the sky's falling down. We've heard that slogan before. So I think, you know, the real problems on the furlough, the reality is what's happening in the private sector. We all saw what's happening. I think it was 119 from PIC alone that's being furloughed. Now that's the reality of it, is the public sector, the jobs that are being lost outside the government. You know, so I think it was so disingenuous for her to find some kind, use another excuse, but don't use that and you know, put fear in these employees, especially a department that worked so hard. And you know what I don't understand is, how can you do furloughs at public health when you're having other agencies come over, leaving their positions? I know that people from GVB has allowed some of their employees to go and assist with not only Department of Labor, but I think public health as well. So why would you furlough anybody in that department? So that's my take on it.
I just wanted to clarify again what Janella Carrera, the public health spokesperson, had said. She just messaged me and reminded me that she did say they'll be avoiding cutting personnel and working within their means as much as possible, but will defer to BBMR. So there appears to be a little bit of a mixed messaging, and I'm also kind of curious, like, why didn't we see a release from BBMR? Why didn't we see a release from Public Health? I just thought it was kind of strange that we saw a release from the Speaker's office. And then the media's left running around trying to ask for a statement, and Public Health's like, oh, what furloughs? We don't know, you know. That's confusing. Senator Marsh.
Yeah, you know, I have a couple of points to add on to the ones that were made already. We're in an election year for a president. Now, granted, we don't get a real voice in that, but we're acting as if October 1st, that we don't have 365 days to work on this absolutely together. There are going to be 15 senators, all 365 days after October 1st. And we're here to care about the community and work for them, but we don't even know who the next president is going to be and what his priorities are going to be. So if it's a new president, he may come in with a completely different attitude and approach to territories and the kind of assistance they should get, or on the daily, the way that territories should be treated. And also, you know, even if it's a continuation of this current administration, there may be some new trends. You know, new terms cause new trends. That's something that happens. And we also don't even know what's going to happen with the Medicaid match. Right now, traditionally, our local match is 17%, but during this COVID crisis for right now, it's 6.2%. There's a very good chance that's going to be continued. So if we're going to be doling out extra millions when we don't even know that landscape, I don't know that that's the best approach. I mean, we haven't thought so. And these two were there with it. We spent 2 days trying to find, $267,000 for charter schools. 2 days on that. So for us to reconvene and get down and say, you know what, that did or didn't happen with the $7 million. Now we have to, for the last 6 months or the last 3 months or the last 9 months, cut $7 million. I just don't even know how excruciating that would be. Entities like UOG have come in and testified that the worst thing that's been done to them, in a sense, has been that at the end of the year, finding out they didn't get something like $6 million of their appropriation, because all year long, they planned as if they had that $6 million in appropriation. And, you know, my stance has always been, it's better to start off frugal and as realistic as possible. And it's always better news to tell people that we are realizing extra returns and we can give you more money, but we planned for the worst and hope for the best.
You know, I just wanted to add something that I was thinking earlier. Why was it that the speaker was the only one that had privy to that information of furloughs? And in fact, a particular number of individuals being furloughed. And why was she only given that information? None of us was given that.
And then, you know, with the clip they provided, I went and listened to it. Bree, did that clip have anything like 80 people are going to get furloughed at Public Health? Because it sounded like a bunch of...
I want to say yes, but you guys were there. Did she say 80?
Yeah.
I think if I remember correctly, she said that she had information that would happen. And then BBMR started talking about, you know, public health is going to have to make choices between matching other federal programs like senior programs, or, you know, they're going to have to make choices in running their other programs. And so I think that's fair. Yes. Public health is going to have to make choices. So is the entire government, because of the amount of revenues that have shrunk. But let me just tell you something about the bill that we were being asked to pass. The one that we didn't pass said, let's take more money out of public health's operations and give that to Medicaid. It was not giving a single extra dime to public health. It was moving public health's operations, meaning personnel money, over to Medicaid. That's all. And that's why it's like fake news, honestly. It's telling untruths. That's not true, that they were going to give any more money to public health, that any of that $7 million would have saved public health employees. There was no risk to public health employees from the information we had received from the public health director and the and the Office of Finance and Budget. And if they choose to make the employees be the first ones that they want to, threaten or cut. It's an unwise choice, and it's a disservice to our community to even make that threat, to even spread those rumors. That's a rumor at this point, because they haven't even taken formal action. It's a rumor, and it's irresponsible.
It just seems that this whole thing could have been avoided if, the administration's fiscal team didn't check out the budget discussions in the first budget. I want to say the budget that you guys overrode.
Yeah.
Absolutely. I kind of alluded to that at the beginning when it was my first opportunity to speak, trying to making it a little bit subtle, but I think everybody got the point.
You don't really do subtle too well, Senator.
Yeah, no, I think I did a twice, to try and give that little kick, but the governor has every opportunity now with what we overrode the veto, the bill that was now passed yesterday into law. But she has every opportunity to use any kind of funding that she has that funds her, deputy directors or any other political hires that she's made to fund Department of Public Health and Social Services with the $27 million transfer authority. So, I think that this bill, that the override that we did yesterday, a bill that I think majority of us feel comfortable with, that's fiscally responsible, and like Senator Marsh said, it's best to give good news than bad news. But most importantly, it's these agencies have to try not only to live within their means, but to also have that a little bit reserve saved on the side. In the event something does come down, that the economy doesn't go as well as this legislature has predicted. So there should be, every department should have a reserve, at least 10 or 15% reserve, just standing by just in case. I mean, we're going through this second wave of a pandemic when most people think that actually this is still the first wave, and most states now are going into a second wave. So this may go longer than we predicted.
Right. Senator Marsh, I wanted to take it to you. I know that you had talked about the incessant vomiting of press releases, my words, paraphrasing here, from Adelup. I mean, it was just, we're in the middle of a pandemic, and you guys have this time to create these really elementary school graphics calling out the legislature. I just couldn't, and the thing is, I know, Senator, they're just too much in their feels in Adelup. There's just too much, and they want to lash out at people, and I feel the frustration. We're frustrated too, but I just think that they need to take a chill pill over there. For their own good, because I just don't see what the use of that whole process was to put out these stupid graphics about the budget, and then we saw that, and you talked about sleepless nights, and we saw the flood of press releases, and then. Not even 20 minutes after you guys override the veto, we got the speaker saying, there's going to be furloughs.
Yeah, and not just that, just the complaining about the budget when you weren't there.
Yeah, that's the thing.
And that was something I think, Senator Marsh, you had mentioned in your extension of remarks.
Yeah, we're here to work together for the next 365 days. This is the beginning of the conversation. Let's not act like this is the end and we're all locked to something. All 365 days, we come up with bills almost on the daily that talk about shifting priorities and shifting money around. We need that organicity. I'm not sure I said that correctly, but yeah, and honestly, I can't speak for the other senators, but I was highly, personally insulted with the terms magic beans and fairy dust. And I made a point of that in the governor's bill that was handed back down, those lapses, every single one of them was in her bill. She didn't take them out. So I don't understand when we're working together in a pandemic, trying not to create panic, why we are resorting to terms like that. Now, they could have said, we need to compromise, we're highly concerned, but to say that we used bad math, an OFB director who was in BBMR for 36 years, takes his job so seriously and was director of BBMR for years, and they're gonna call that bad math not even knowing our basic math, magic beans, and fairy dust. We should be insulted. Our data is legitimate, period.
Oh.
And my
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
They issued a statement. The budget law now represents a clear and present danger to some of the most basic services at public health. it will force us to cut services for our elderly, our foster kids, vulnerable adults, and our COVID surveillance and contact tracing unit. And it will likely mean the reduction of hours at the Judiciary of Guam. Our job is to manage these consequences as best we can. We fought for a better budget. Now we will seek amendments that make this budget worthy of our people and the healthcare heroes that serve them. That was the statement from the governor's office following the override of the governor's veto.
Reactions? We'll go ahead and actually, Senator Therese, our feed was cut while you were speaking, so I don't know if you want to just respond to that statement and then jump back into what you were saying.
Sure. Well, hopefully I made it clear that furloughs is a choice, and I don't believe that is the choice that needs to be made, especially at public health today, and that we have to work together to ensure that public health gets what it needs, that it gets the Medicaid money. And I just want to point out that the governor's bill was not giving public health any additional funds. The governor's bill that she had proposed was only going to move public health funds to Medicaid, which would have exacerbated the personnel pay issue, the other program issues, and all of that. So it was not a real solution either. And so we are going to work together, and I want the public to be assured that we are not deaf and blind to what they are suffering, to what the importance of public health is. Especially I am not. And we feel that, you know, we are all in this together. We are going to have to get through it together. We feel for the sacrifice of our frontliners. We feel for the deaths that all our families have, you know, we feel that. And so I just want everyone to know we're going to work together. I am determined. We are not going to let, you know, fake news or these unexplained, you know, announcements of furloughs. I hope people just don't take that seriously until the governor announces that's exactly what her priority is. And I don't believe she would do that. I do not believe this governor is going to give up Medicaid funds. I do not believe this governor is going to furlough public health employees when we need them the most. I don't believe that. And I certainly hope it does not happen like we saw in the past, the shutdowns of police stations and fire stations to make a political point. I really pray that does not happen. I don't think our community deserves anything like that.
Right, but she says it will force us to cut services for our elderly, our foster kids, vulnerable adults, and our COVID surveillance and contact tracing unit. And it will likely mean the reduction of hours at the Judiciary of Guam. I mean, those are the words from the office of the governor as a result of this clear and present danger that this budget.
And they're saying they're being forced, but they are not forced. They have broad authority. They make priorities and they make choices every day. And that's what we're asking, is to make the best choices for the people of Guam, not the worst. Make the best choices for the people of Guam. The ones that will make the community feel safe.
Senator Tello?
You know, it is about choices, and this governor definitely has that. With the 15% transfer authority, there's her choice right there. It's plain and simple. But I want the public also to know, to rest assured that every month we are going to be looking at revenues, and if there's any revenues that are exceeding that amount, it's definitely going to go to, public health and other areas that are desperately in need of it, essential. So I truly don't believe that the governor is going to fail our public health system at all. I mean, she was a nurse.
Is still a nurse.
Senator Kelly?
Still,
yeah. She keeps up her license.
Yeah. Okay. Yeah. Even better. Even more so. So no, it's time, and it's true. It's time that we put down the gloves, and start working together. the budget was one of the biggest things that it's the biggest responsibility this legislature has. And we did our due diligence. We looked at the numbers. We're being very conservative. I wish we could even be more conservative, but I knew that anything other than this budget that would come out of the governor's office would exasperate the revenue. And where are we then? One of the questions I asked Director Burns, can you explain what a deficit is? And when he explained it, I mean, it was just clear as day. Spending money that we don't have. We don't need to be in a deficit. So that's my take on it. But he can guarantee that I will watch this diligently and ensure that we stay within our means.
Well, I'm glad you guys still have faith, because when you say that, I think about the people that waited in lines for the grab and go at GDOE, and people who are waiting for some sort of local programs, local financial assistance programs, and that never came until CARES Act happened. And then we saw, okay, we're going to use some of this for that, and we're going to use some of this for that. So I'm glad you guys are keeping faith in this administration, because I tell you what, I bet there's a lot more people out there that have lost faith, that have lost trust in this administration. And so what happens when and if these furloughs do happen? What will the legislature do, or what can the legislature do?
Senator Kelly?
Well, I want to build on some of what they were saying. With the budget as it was, I expressed throughout the process and even in my closing statement, I'm still incredibly worried about our special funds. We see that they're underperforming, and yet some of them are still being put forward as if they're going to perform in certain ways. And so, I think we tried to be fiscally prudent, but there are still concerns that we won't even meet our fiscal prudence. And so we have to be aware of that. And, I keep on emphasizing this is the beginning. We're going to be here. The governor's going to be here. The agencies are going to be here all 365 days of the year. We're going to look at the money coming in carefully. And another concern that I had with the governor's bill was taking away $1 million from GCC. GCC just had their workforce type of conference, right? Opportunity conference. And they're going to be key. They're running boot camps to get people into positions that are stable, that are highly needed and well paid and well respected. And we need GCC to help re-envision and rebuild our economy. And the transfer authority is still there. If it ends up being their choice and their priority, they can still take money from GCC, but at least for myself, I wanted to leave that money with GCC so they can be part of that economic recovery for us. So there was that concern. I do agree with the sentiments of my fellow senators that at the end of the day, we have to respond with every tool that we can, with every possibility that we can muster to address these issues. I do think that the administration will as well. They have been seeking a lot of federal funds, and that's important part of our survival through this. But I just want us to get to a point where we are beginning our next phase, and that's addressing the realities that are before us and how we're going to serve the people of Guam and get past the press releases. There haven't been any coming out of, I don't believe, the legislature in general that have been of some of the same nature that we've received.
Yeah.
So, I'm calling on all of us, all 15 senators and the governor, for us to work together.
Senator Terlahi, you got that Dear Senator letter that you read out on the session floor, the one that called out your moral and ethical and whatever
Fiduciary,
ethical something or other.
and senators that are
right?
grandstanding.
And then so this latest release from Adeloop, I mean, it's clear. You read between the lines. They're targeting public health, judiciary, both agencies that fall under your oversight. So I can see that there's a constant attack on you. Right. And let's just be fair and address this criticism, because I feel like they're kicking the ball in your court and saying, hey, well, public health, judiciary, look, all these problems they're going to have. Right. So how do you kind of respond to that? And how do you respond to constantly being targeted?
I'll tell you, Chris, I'm not a born politician. I'm already one of the older senators. I think I came into this late in my life. It's something I really just wanted to do to help the people of Guam. And, I don't mind putting everything I've got into it. I am absolutely willing to do that. And I made that decision that if I'm in, I'm going to do it all the way. I'm going to do the best I can before I step out. And so I still intend to do that. And I'm tough. Luckily, I have 8 brothers. So I attribute my success at getting through that kind of stuff to them because, brothers, they don't stop. They keep teasing and harassing me. But no, I'm kidding. I love them. But it's just that I just want to see past all of this. I think some people are being misled by politics or thinking this is the way to success right now. I don't think so. Right now, our success is on focusing and not letting anything distract us from what we are really trying to achieve. And so that's all I'm going to try to do. And I think that people deserve that. And that's really why I guess I'm willing to. I'm not going to say I'm going to put up with it, but I'm going to get through it, Chris, because it's kind of like, boy, look at me, I'm a lawyer and I can fight them on it, but I feel bad that if they're going to use that same tactic on other people, it's just not right. But this is I don't know, maybe it's a game for some people. It's not for me. So I just want to keep doing what we're supposed to be doing. I'm going to keep focusing. And want to know what's really ironic? During the budget 3 weeks where, we were there, the legislature, going it alone, luckily public health was there to help us. GMH was there to help us. But those other administration officials, they were not. But if you can ask any of my colleagues, I was practically begging them. I think I almost broke down at one point because I wanted more money for public health. I wanted it from agencies that I thought were not as important. I wanted it from all sorts of, in any way. I was racking my brain trying to come up with any way because the increased revenue way was not passing. So instead of getting stuck there and, it's not a power trip thing, it's finding another way. And that's all I'm asking everybody. When you run into one wall, let's just find another way. There are so many ways to do this. And if we can do it with some kind of respect and collegiality, it will be better for everyone. And most importantly, what do the people deserve? So I'm just going to try to keep it together for that, Chris. And Sabrina, you are right. I mean, I was really affected in March, when we started, after all the planning that I went through and listened to with public health, the hospital, when things started to happen in March and you start to see the long lines for food and you see, businesses closed up to now, I mean, every day it affects us. And I think, I'm hoping it's making us wiser and it's making us choose what we're going to battle over and what we're not going to battle over, and that we're going to, always side with the people because they are the ones who need us. They need us.
And I have to say, throughout the past several months, I've seen you guys, the three of you specifically, really fighting. And Senator Marsh Taitano, some of your speeches on session floor, it really, I almost wanted to cry. Like, my gosh, she's especially your extension of remarks. You know, and that's why I had to play it the other day.
Right.
Just how you guys have been doing this, basically, alone, and there were opportunities definitely for the administration to give their input and to work together, like you'd said, and just to hear about the furloughs and all this other stuff afterwards, it just kind of makes me mad.
I drew the parallel earlier, and I know you did as well, Senator, about becoming the thing that you hate. We hear so much about from Carlo Branch and Adelup about former Governor Calvo and the closing of police stations, the fire stations, and then to see these same tactics, although the financial circumstances obviously are different, but to see kind of the same thing being done now with this administration. I mean, the hypocrisy, it's just crazy. We're really behind on time. Senator Talai, thank you. We'll go ahead and Senator Tello, and then we'll shoot it over to Senator Kelly to close it off.
Oh, well, no, thank you. Did you want me to speak before? Okay.
Yeah.
Well, I just want to thank you, everyone. You know, a lot was said today, and I agree with my colleagues here. I didn't have any brothers. I had 4 sisters. Now it explains to me why I'm so tough. I didn't have brothers, so my dad kind of made us all into, being real tough kind of girls. So, I love my sisters and my father for it. But, I'll continue to keep the administration's feet to the fire, and push for it. And definitely it's the public that drives my fight for them and push. So that I appreciate the time and the opportunity. And for my colleagues too, all their work they've done in the legislature to push this veto bill to become law. Thank you.
Senator Kelly?
Yeah, so they have, the fellow senators here have expressed themselves very well. And for me, as Sabrina was saying, it's a passion of mine. I do have sleepless nights. I wasn't quite expecting all of that, but I care so deeply and I try to be so thoughtful. I want the decisions that I make to be data driven, but for so that I can make the best decision for the people, for the community, based on all the evidence possible. I try to not get emotions involved because it's very easy to get emotions involved. But when we have the responsibilities we have with the fiduciary responsibilities and performance of our government responsibilities, it has to be driven by evidence that is going to lead the way as to what is going to truly serve the community, not just for the now, but for the long term. And as I've said before, let's just begin this conversation. Let's not act like this is the end. We have 365 days of rolling up our sleeves, checking out every possibility, unturning every stone, to continue providing what we can for the community. The entire world is suffering, and we all need to figure out how to get through this.
Thank you, Senator. Senator Terlai, thank you. Senator Tello, thank you, ladies, for coming on. Appreciate it.
Okay.
Take care.
Wash your hands. Stay home. Right on. Stay out of trouble. Don't open any weird envelopes you get in the mail from Adelup.
Create a great day. Bye-bye.
Bye. Ooh, boy.
They've been officially dubbed the 3T squad?
Yeah, in the comments, it's the 3 T's. Terlahi, Taitagui, and Taitano. Let's keep it in the KUAM News Zoom room where we have Diana Calvo, the head of Catholic Social Services, standing by.
She's got to unmute her camera.
Okay.
So Diana Calvo, she's with Catholic Social Services, as Chris mentioned, and Monsignor David Kitakwa, right?
Yes.
He just passed away. He was the actual founder of Catholic Social Services. And so thanks, Diana, for coming on the show this morning and talking about, some of the work that you guys have continued to do over at CSS, and also just sharing, your memories about Monsignor Kitakwa. Thanks for coming on.
Good morning. Thank you for having us.
Of course, and I will just start there, with Diana, because I know that we brought you on to talk about the Safe Haven Homeless Shelter, but obviously this announcement late yesterday about the passing of Monsignor Kitagua, we do want to get your response as Catholic Social Services.
On the Safe Haven or
on Monsignor Kitagua's passing.
Oh,
Yeah.
well, we're very saddened by the passing. We've been, we were aware that he was admitted to the hospital, and we've been praying for him. I've met Monsignor when he was still Father David Kitagua in 1979. And, when the Archdiocese referred to him as a gentle priest, that is very reflective of his person, because he was a very gentle soul. And when I came into CSS, we had more frequent contact. He was always very, very gracious to come and say Mass for our client groups. And his sermons to us, which included, clients, staff, our providers, have always been very on point in terms of the work that we do. And, we've had some really good chats, conversing with him at the rectory, and him sharing, his thoughts on what's transpiring in the new years, if you will, the differences between then in the 70s and what's happening now, and he's a very intelligent person. And, I personally will miss him because he's been very gracious and very giving. He is, he was the first executive director of CSS, and he was also a board member. So he is an emeritus board member as well as emeritus executive director for CSS. And every opportunity that we have, we invite him, and he always makes a point to come, which really just shows, his commitment to the work that he started, which he started really with love, and sorry, I'm just, yeah, we will miss him. And, we have staff that's reached out to the family to just offer our support for whatever that they would need.
We know that Monsignor was sick, Diana, but did you anticipate that his passing would come this quickly?
Well, he had slowed down, and as even some of the administrative changes were occurring, within the Archdiocese, he still was very poised about some of the decisions that were made, in sharing, he accepted it, it just gave him the opportunity to prepare more, I think, but he was never he was never negative about anything, really. In all the years that I've had interaction with him and things were pretty, going bad or whatever, he never at least projected anything negative, and just, said we need to find a better way. And that was how he redirected, how we focus our energies into coming up with other options instead of just dwelling on, the issues at hand.
What are some of the other lessons that Monsignor Kitagua's life has taught you? Obviously, Catholic Social Services, that's where he came up.
Well, he's a Catholic priest, and it's really tying in prayer to support people in what they're going through. And even though over the years, CSS has employed individuals of other faith religions, and, we would have either a prayer service, still tied into maybe our Catholic religion, but also recognizing other faith-based groups that CSS works with. And above all of that, it's really just, embracing a level of spirituality to be able to refresh us. So it doesn't matter what kind of, even if you're not a religious person, but if you have a level of spirituality and you reflect and you meditate, then it helps a person to come into perspective. And then in doing that, it provides some level of clarity on how we can approach, whatever it is that we're having to address. And, I try to mirror that to the staff by providing them, with those kinds of encouragement, prayers and meditation. And particularly now in this COVID environment, it's also reassuring staff because we continue to do our work amid the risk of exposure, and we're doing what we can to calm people, even our clients, and to reassure them, that we're available to help them depending on what it is and how we can help them in that regard. And, it's helping, at least for our employees, it's helping them to kind of be able to, move through what's happening, because we've had those effects in our within our employees' families. They've had staff, their own members who have lost their jobs or are furloughed without pay. We have staff that have family members that have been exposed to the virus. And so, the reflection, the prayers, I think that all helps to strengthen us every day so that we can approach our work with the thought that, God's going to protect us, really.
Right. Diana, I mean, obviously Monsignor Kittigwa beloved by thousands on this island, but with this pandemic and these restrictions that are being placed on funerals, how hard do you think it is going to be for the people who want to say goodbye to Monsignor David Kittigwa when they just simply can't through the way that we always do in our culture, which is with the funeral?
I don't know. I know that the chance to see him, for the last time, to see, probably is not going to happen, but to be a part of the services that, honor him, I think, people will have a very difficult time coping if they're not able to be physically there. For CSS, I mean, we will help the family in however way we can. And while we recognize that, as much as we would like to be there, and our board of trustees, including those that are still alive who were part of his initial board of trustees and directors, who would want to be there, at the very most, we can offer him prayers, and be with him in spirit, really, because I know he would not want his funeral to be a cause for other, grief or sorrows. And so I just hope that, whatever transpires in the decision, that the community will find a way to respect the wishes of the family, particularly if Monsignor had wishes, and if that's going to be communicated, then at minimum, we honor him by complying with whatever is his request.
Diana, let's switch gears here to the Safe Haven homeless shelter. If you could just give us an update. We heard this was a little alarming that there's from Lieutenant Governor, we heard there's a waiting list to get into this shelter. So just if you could just status update us on the Safe Haven homeless shelter in MTM.
Well, so the Safe Haven was, I guess it, for lack of a better name, was focused on providing a shelter for those who are street homeless. And based on both HUD and CDC recommendations, the highest recommendation for how to address street homeless was to put them in a form of housing where they are able to self-quarantine in their own space. And so there were other designs, I think, that were identified, and they were looking at resources that are available on Guam. And so the Global Dorm apartments in Mighty, I guess, was that option to implement. CSS is only contracted to provide shelter supervision and case management. All of the other logistics are taken care of by the government. It is, I guess, facilitated by several staff, including Department of Public Works and the staff from the Lieutenant Governor's office. And so we open in the latter part of July. There's 39 rooms that we place individual families. And our focus is two parts. So one, the families that we brought in, we provide supervision. We coordinate what are their services needed. We coordinate whatever access to public assistance benefits and so forth. And then we start to initiate that for more public housing options, more permanent housing options. Since July, we've sheltered a total of 122 individuals. We currently have 27 families, totaling 72 individuals. And the composition of those households include 2 families with newborn children, to an elderly couple that also has an adult child. Most of the individuals that were initially sheltered lost their jobs due to the pandemic. So we did have street homeless who were working. They just didn't have a place to stay, but they were working. But we still have people who are working. They're just not able to, with their reduced hours or whatever is the situation with their employer, they're not able to afford rent. And so this gives them an opportunity to still keep their job and be able to either build up their savings while we try to determine if they're eligible for other housing subsidies. The focus for us is not necessarily on GURA housing, because we already know that, most of the vouchers have been issued. But if a person is eligible and we make the referral and they are one of the few that are already on the wait list, then, they would be the lucky ones. And we actually have 5 families that are waiting for their GURA paperwork to be processed. There's things that are already in place, and I think we're just waiting for GURA to either schedule a review of the packets and then to also schedule an inspection of the units these individuals will be moving into.
Right. Well, really, Diana, it's good to hear the work you guys are doing. And although, this is just a small, I guess, amount of people because of street homeless, because we know that, there's a whole lot more people out there that are in need of help. So I guess, we have to do, and this is only just for the state of public health emergency, right?
Yes.
I think that's what Mr.
And
Sakazaki said.
it is geared towards, trying to mitigate the exposure of the virus to transient individuals.
Mm-hmm.
And so even before that, CSS was doing outreach, and we've been handing out actually masks and bar soap and hand sanitizers, and just finding, and we brought our nursing surveillance team to just do some checks to make sure and educate people about what's available and what's happening. And when the dorms became available, we surveyed those individuals and asked if they would want to stay in housing, at least for the short term, so that they also have a roof over their heads. And for some, they accept it. For others, they're not wanting to leave their space. So we still keep in touch with those individuals that have not accepted to be housed.
All right, Diana, thank you so much. Chris, did you have anything you wanted to ask? Good.
Well, I did want to ask Diana because I heard that some people have been, I don't know if this is the right word, kicked out of the homeless shelter. Can you talk a little bit about that?
Yes. So, we, even though we're sheltering individuals, we do have some house rules.
Of course.
And when we brought in people, there's we have to. So the effects of, I guess, the stress that's brought on by a lot of different things is highlighted when you're in a congregate setting. So we've had, drama, if you will, between couples.
Aye.
Some of it has become physical. And so we have evicted individuals who are not complying with the house rules. Our most recent evictions really was when PCOR 1 was implemented, and we kind of locked down the shelter, and those that are employed or having to go to the doctor's appointments and all that, they're allowed to come and go, and we do the screenings before they re-enter the complex. But we've had individuals that sneak out or were very defiant and said, no, you can't force me to stay here. I'm going to go. And so when they left, and we don't know where they go to, we cannot afford to expose individuals in the unit, because even though they're occupying single rooms,
right, they're still
the main
interacting
entries and the hallways are all common areas.
Right,
And so 4CSS infection control and sanitation is always big. The COVID is just adding another item for us to be on top of. But 4CSS, we've been very strict about making sure people do not present themselves with any kind of infectious disease. And we have people that have said, upon entry, we're going to have to quarantine you from the others for at least 14 days. So that, if you do have whatever symptoms and we get you checked, we don't want to have any kind of exposure. And some people do not want to be quarantined. And so, if they're not wanting to comply with simple rules like that, then, which are really safety rules, then, we cannot afford to have that affect the safety of everybody else, including my staff.
Right. Good call,
So
Diana.
I think in total, we've probably evicted 3 families. We've evicted an individual from a family, so the family is still at the dorm, but the person that caused the incident was evicted. And for those that have really uncontrolled alcohol issues, we're not allowing them to come back in until they accept to follow the rules.
Wow.
And, unfortunately, our proximity of the dorm, we're kind of behind a complex that also has, I guess, like a bar. So even though they're closed, these individuals still find a way to consume those alcoholic beverages somewhere else, and they come in drunk.
Well, it's unfortunate, Diana. That I guess comes with the territory, right?
Well, that comes with the territory. And, if we were dealing with adults only, there could be certain exceptions, after they've slept it off and all that, we may have readmitted them. But we also have families with children, and we have 2 families with newborns. And so, we're needing to focus the priority really on the families with young children. And so it does take a lot to make sure that the supervision is tight. And we have no exceptions for any kind of deviation from the safety rules.
Right on. Diana, thank you for coming on and, remembering Monsignor Kittigwa and also telling us a little bit more about the operation there at the Safe Haven. I appreciate your time.
Thank you.
Okay, wash your
Have a
hands.
good day.
You too. You too, Diana. Bye. Let's keep it going. The KUM News Zoom room where we have standing by Public Auditor BJ Cruz. Good morning, Auditor.
Unmute.
Unmute your microphone. There you go. Thank you for joining us, BJ. We wanted to bring you on because I don't know if your ears were burning yesterday. Was that yesterday?
Yeah, that was yesterday.
Yeah, we had the Gora executive director, Ray Taposnia, on the show to
Explain away the approval.
When it just was a real cluster furlough of an interview because the board approved the raises, and then the public was pissed off about it, and so then they said, oh, we're not going to get the raises now, probably because the public was pissed. But then he kind of played it off and said, oh, we never intended to, I wasn't ever going to get the raise. But anyway, why I brought you on was because he kept saying that this had something to do with the Office of the Public Auditor.
Well, actually, Chris, my ears have been burning all weekend. I woke up on Saturday morning to find the news story and was exhorted. I mean, I was just exorcised. I was so furious. I sent off a whole bunch of emails and texts to individuals, just that I couldn't believe what had happened. We had met for an hour on Thursday. And on Thursday, we were talking about the audit that we were doing about Gora and pay raises of the prior administration and some issues that relate to the current administration. And in that hour, he never mentioned that he was planning on implementing or getting the board to pass the increase the next day. In fact, the chairman of the board was on the meeting, and he never mentioned that the board had it on its agenda for the next day. And I was just mad because when they told me that they had approved this in June and they had made it retroactive to January, I told them, I said, I would caution you that there is public law that prohibits retroactive pay for unclassifieds. I kind of know about the law because I think I may have actually written it. And,
you don't say.
Yeah. And so the HR person insisted that no, this was a performance audit, performance evaluation, and that though it was done in June, it was due last January, and so therefore it could be retroactive. I just said, well, speak to your legal counsel and make sure that you guys comply, because for me, the issue was getting things, the process and complying with the law. But the other thing that really upset me was on Saturday morning, I woke up, I found out about this article because I got a text from a constituent who was chiding me and teasing. They said, oh, Gora got a 4% increase. The board must have ignored your audit and your complaints about the fact that Gora was so late. And that's the thing that really upset me, was because people don't understand, and even the news reporter that did the story today in the paper only relegated it to a one sentence at the very end of the article about the fact that Gora's delayed completion of its audit this year was what delayed the GovGuam audit. The GovGuam audit was issued on the last day of August, just as the legislature was voting on the budget. I had planned, since I had gotten to the auditor's office, that I wanted the audits out early. So all the contracts with the external auditors has a deadline of March the 31st. Unfortunately, that was in the middle of the first lockdown. And so many of them weren't completed, but many of them were completed subsequently in the month of April and early May. But GORA went all the way to the end of June. It wasn't ready into July and into August before it was completed. I wanted to issue the GovGuam audit on June 31st, like it is supposed to be done by statute. But I had to bite my tongue and grit my teeth, because if I had issued it on June 31st, the external auditors would have put made the audit qualified, because of the fact that we were missing a significant component of the government of Guam's finances, GORA, in that audit. And I couldn't chance that, because if that went into the audit for financial audit for this year, that was GovGuam's financial audit, the bond market would have thrown us into the deepest junk pile that they possibly could. And there was a possibility that the federal agencies would cease dealing with us and providing us grants. And I didn't want GovGuam to turn out to be like what we're having with GDOE, with a third-party custodian having to watch what's going on. But GORA is right at the verge of that. I mean, this delayed audit, making reconciliations late into July and into August, and then having as many compliance problems as they did, could possibly be reason for HUD to find that a third-party custodian should be brought in to overlook the operations.
Hold on there, BJ. Hold on just a second, because I just want to read this quote here from our story yesterday, where we quote the GORA director. Where's that at? He had said that, I'm stretching here, I can't find the damn story. Basically, he said he gets paid a lot of money because he does such an awesome job over. Oh, yeah, here you go. This is a quote from your buddy Ray T. I get paid a lot of money because I think our organization is doing extremely well. A lot better than what's going on at the legislature. That's for sure. Emphasis added on my part.
I heard that yesterday. I mean, I couldn't believe that. I mean, really seriously, people don't understand the jeopardy that agency placed the entire government of Guam in by the fact that its audit was so delayed. Because of what happened to GORA, I have since August issued a directive to all the agencies that by yesterday, they were all supposed to have provided my office with a copy of a Gantt chart wherein they list all of the milestones or the important components of their audit, and they give me a date by which they expect to have completed all of those items and listed everything. And GORA finally got theirs in last night, but that's the way that I'm having to treat all the agencies. And now I'm going to have my auditors babysit each of these departments every month to make sure that they meet their milestone completion dates on that Gantt chart, because I want the audit out in time for the legislature to be able to write its budget, know how much was spent, know how much was saved, know how much was lost as they write the budget and as they deliberate on it. I'm mortified. I am really embarrassed, and I apologize to the legislature that I couldn't get it out until the day that they were voting on the budget.
Right.
And I have full intention to not repeat that next year.
So basically, you're saying basically that you were ready to come out of the GovGuam audit, but you had to sit or wait around for Ray Tapasi and GORA to turn in all their paperwork.
Yeah. And I'm thinking about writing to Senator Chalahi because she had a bill that was going to make it a statutory requirement that March 31st be the date that the audits were to be completed. And I wrote to her and I said, I've already put that into the contracts. Maybe this might not be necessary. But after this experience, it's absolutely necessary. And in fact, I may ask her to put a provision in there that states that any agency that does not issue a timely and a clean audit or audits with multiple compliance issues, that the board of directors of that agency is precluded from granting that director and deputy any increment for that year.
BJ, so are we getting a GURA audit? Because Ray was kind of talking about we're getting a GURA audit. And then also I wanted to ask, because we had him on yesterday, and man, he said a lot of stuff. One of the things he said was that the feds wanted him to run GURA.
I don't know. Well, the feds now see how he operates it and how he can't get his audits out, and they have a compliance report from the external auditors showing how well he's done with the programs. With all the money, additional money that they believe they have and could spend on increasing all their salaries, I think they could better invest in hiring a team of accountants and auditors for various programs. They have lots of work there. They really do. I mean, I understand that. But they need to have someone out at each one of the programs to be able to do reconciliations on a monthly basis, and as that month ends, within a couple of days after the end of the month, everything is reconciled. We don't wait until 15 months later in July, you make a reconciliation for the previous July or March. That's just unconscionable, especially when it jeopardizes the entire government of Guam's operation because your audit is so late.
Do you have a problem with Ray Taposnia's honesty, PJ?
I said to someone, we have our own Mr. Trump.
Can you elaborate on that?
Well, his lies yesterday were just unbelievable, and he's able to do it with a straight face. To say what was it he did on your show? Well, the board of commissioners let me operate things, and they won't stop me from not implementing my salary increase. Well, no, they'll figure out some way when we're not looking to implement that. The only way to take care of that is for the board to meet and rescind it. Because when we did an audit of the GURA salaries, there have been various adjustments along the way. He may have started with 136, and then the next salary was supposed to be 153. They increased it to 144 somewhere, and we couldn't figure out where that was at.
Yeah.
They had increased the salary for the entire department, and they were giving the new salaries to them, and they were huge. I mean, since January of 2019, they've gotten 4 different salary increases for a total of $22,000 and $23,000 each.
Yeah, our Peter Santos had written a pretty gangbuster story about this, and he detailed that, yes, Ray Taposnia was hired at GURA in January of 2019 at a salary of $137,000. While this recent 4% raise approved by the board is making headlines, Taposnia had already received what we calculated as an $18,000 raise in October of 2019, just 9 months after he was hired. bringing his salary to $155,000, not including benefits.
Hey, the deputy also.
And the deputy also, yes. So what's this
Yes.
audit going to say, BJ? Or go ahead, please.
The other thing that I think we should start thinking about is, I understand, we at the legislature gave the autonomous agencies the authority to implement their own certified technical professional salaries, CTPs it's called in GPA and GWA and the port. But the thing is that those salaries are for people that have certifications, people that have the technical skills, and individuals that have professional degrees in those areas, like the engineers that you have GPA and GWA. But for the political hacks that are brought in to take over the departments whenever the administration turns over, they've had no previous certification, technical or professional experience in that, warranting the exorbitant salaries that they're getting. The CTP was meant for certified technical and professional persons, not for political hacks.
BJ, in the interview yesterday, Ray kept saying that, there's an audit coming out, and he was kind of alluding that the audit would somehow, this is a loose translation on my part, very loose, would somehow make us think that he deserved like a 40% raise. You know what I mean? So he kept saying that. And when's the audit coming out? And can you give us any preview? Although it does sound like you did already.
It's not. One of the things that the process, they've gone through the process. I have to commend him for making sure that they comply with the process. The law requires that 6 months after you're hiring, there's to be a performance audit, and then 12 months every 12 months thereafter. And that the law also requires that the board had to ratify the performance evaluations. It's true that in the past, GORA had problems with complying with the statute. Currently, the board is complying. It ratified it on Friday as per the law. But it questions their performance evaluation of someone when if you just look at, if someone just takes the time to read their audit, the audit does not speak well for the management. The financial audit.
Right. Well. Anything in closing you want to add, BJ, specifically about Ray Toposnia's character?
No, I just am really appalled. Really seriously. I can't repeat it on public air, so that's fine. Thank you very much for allowing me to come on.
Of course.
Thank
Text me
you.
it, and I'll do a loose translation.
I think appalled was pretty strong.
Yeah, appalled was right.
That was a kick in the gut.
Right. Now we get Ray to come on tomorrow to respond to what you said, and then maybe we could get you guys on together. I don't think Ray wants this smoke, though. We'll see. I hope he does.
Okay.
I hope he does. Thank you, BJ.
Thank you.
Okay, we'll see you. Wash your hands.
Will do.
Oh my gosh.
Damn, boy.
No further questions.
Yeah. I rest my case, Your Honor. No, I'm going to reach out to Ray because, like I told Ray yesterday, man.
Did he say liar?
He said, yeah.
Lies?
Okay,
I haven't.
I was taking notes because
Jay was taking notes. Thank you,
because we use these for the captions for the YouTube clips, and the specific quote was he goes when Public Auditor BJ Cruz speaking about GORA Executive Director Ray Toposnia, he said, quote, "His lies are unbelievable, and he does it with a straight face."
Oh my goodness.
And then he also said he's appalled by his character. and that he can't repeat what he thinks of it on public airwaves.
Yeah, we definitely need to get Ray on just to, defend.
Right. You got to defend your honor, Ray.
Yeah.
Got to come on, Ray, and you got to defend your honor. Your good name has been further besmirched by the public auditor. And I don't think you should let this stand. I don't think you should let this stand.
I want to go read this audit. Is this the one that's coming out in 2 weeks?
Well, so what he basically was saying was that they were waiting for Gora to turn in their part for the whole government-wide financial audit, and they got it. So I guess we got some reading to do. When I say we, I mean...
You mean Peter?
Yeah, Peter Santos, the Gangbusters reporter. Hey, it's 9:52.
Welcome to the team, Pete.
Yeah, Pete, right on. We take a short break and we're going to come back and close out the show with our partners in the Thrive Coalition. That's next on The Link. It's The Breeze, 93.9. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your life moves quickly, so you need a card that keeps up with you. Tap and go with our contactless debit cards. Just open a checking account at First Hawaiian Bank.
If you plan on leaving your house, don't forget your face mask. Along with hand washing and social distancing, wearing face masks can drastically reduce your risk of infection. Many people who catch COVID-19 can be contagious before they even start showing symptoms. The more people who use face masks, the less the virus can be transmitted and fewer individuals are exposed. When we both wear face masks, I protect you, you protect me, and we are both safe.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
Simon Sanchez, home of the Sharks, in the house. Also got a little note about Hoffaday Market in Jigo has been closed down. It looked like there was some sanitization, so I don't know. That's your neck of the Hoffaday. That's right in the turn to Sanchez. They've been closed since yesterday. I got a call on the line, and then I got a eyewitness account that they were sanitizing in the store, so I don't know. We'll try and find out.
Okay.
But I just know my daughter's bummed because that's her snack. She gets her snacks. Right. 9. So I'm asking.
That's the eyewitness account?
Yeah, I'm asking for a
Okay.
friend. Okay. 9:56. It's the Link of the Breeze, 93.9. Let's go ahead and bring on our partners from the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. In the KUAM News Zoom room, we have, of course, Sergeant Paul Tapao, Guam Police Department, Vera Jose, who is the youth sector rep for the Thrive Coalition, and Kathleen Uggan, the coalition coordinator with West Care Pacific Islands. Good morning and welcome to The Link.
Good morning.
Hi.
Good morning, Sabrina. Good morning, Chris.
And I know Sabrina wanted to talk with you guys about this and find out a little bit more about what you guys do in the community.
Yeah, and let's just start there. How did this Thrive Coalition come about?
Yeah, so back in 2017, West Care Pacific Islands put a call out to our community, especially the different sectors, to create a coalition that would address the youth substance use, specifically in our villages. So from there, the membership started to grow, and we were fortunate actually to get a 5-year grant from the Drug Free Communities grant from SAMHSA last year, November. And this grant just basically provided us the opportunity to reorganize and also gave us more resources to carry out our environmental strategies to create community level change. So the coalition is now 18 members strong and are very diverse in their experiences, culture, and they bring different ideas and perspectives. And they're very much invested in a drug-free Dededo.
So it's specifically just for Dededo?
Yes, so this particular coalition is going to focus in the village efforts. And the idea behind it is that we want to create best practices and we want to share that with the other villages so that way we can, focus on the environmental factors that are just unique to that community. So what might be affecting Dededo is not necessarily applied to Inarajan or to Muning or Manilao. So it's very tailored to the community that we're serving.
And so then can you tell me about the different organizations and community groups that are involved with the Thrive Coalition?
Yeah, definitely. So we have 12 different sectors, but also we go beyond that. We have GPD, of course. We also have the Judiciary of Guam, Public Health. We also have nonprofits like Island Girl Power, Sanctuary Incorporated. We have businesses like the digital marketing, Eventide Hayes, and we have PHRS that's actually working to create a youth leadership training series for our youth coalition. And also the most important part of our coalition are the parents and the youth that actually live and reside in Dededo. And so different perspectives come together so that, they say two heads are better than one, right? Mm-hmm. So those are just some of the agencies that are involved.
Mm-hmm. And how many, what's been the response?
It's been really positive so far. A lot of, so we did an outreach or a couple of outreaches, and in the community, they were telling us that it's great to have this type of coalition. It's just timely because, the drug epidemic in our community is just getting, with this COVID-19, it's just getting worse. And even with the use of alcohol, it's increasing. And so we've gotten a lot of positive responses, and also our coalition members have been really active in engaging with our community assessment phase. And so we're in that stage where we want to be informed in what's in our community, what exists right now, what are our priorities, and also what are resources that are existing in the community.
Mm-hmm. Yeah, when we talk about the drug abuse and alcohol abuse, how young how young are we seeing kids who are resorting to this?
Vera?
From statistics that we've shared, there's even youngest to elementary that they've been using drugs and tobacco and alcohol. It's not always adults. There's a lot of youth that are starting to see it as peer pressure, and it's coming to a thing where it's like if you don't do drugs, you won't be cool enough to hang out with us. It's kind of that mindset with some people.
What kind of drugs are we talking about here? Elementary school? Are elementary school kids smoking
specifically? Ice? Oh no. Specifically, like e-cigarettes or nicotine.
Oof. I mean, I'm not saying that's good. I'm just like.
They're young.
Yeah. Wow.
It's surprising.
Yeah. Paul, what are you seeing out there, and what are you hearing?
So, again, with the Thrive Coalition, and we're going to hit home with the community. It takes a community to raise a child, and just to go over some of the stats, and we talked about this yesterday briefly about the gateway drugs or the gateway corridors that kids will use, and when you see a third, second grader in possession with e-cigarettes and vape, it mirrors what Vera said about fitting in and being cool and everything, because their older siblings may have access to that. You may have parents who have purchased that for their child because it's like they're doing it too. And it from my line of work with the Guam Police Department, we talked about it yesterday, and how you graduate from tobacco products to alcohol, because now this becomes the norm, and then of course to the heavier substance such as cannabis, and then to crystal methamphetamine. So years back when I was in patrol, I did a second grader who brought in cannabis, and it was just they didn't know how to roll it. They took the paper from their filler paper, and they tried to pack a ball, and they got caught because they tried to burn the bathroom down. And this is just some of the cases that we deal with in the line with police work. And of course the courts, they see the aftermath because kids have to go through the system and everything, but it's out there. And in line with Dedido, and I think because I was a part of the consultation team in 2017 with then director Sarah Dedido, and it was spearheaded by Dr. Juan Flores. And we asked the same question, why Dedido? And Dedido is really the diversity that you have at Dedido, and of course the population in itself. So that made more sense in moving and spearheading this type of initiative, because like I mentioned yesterday, you have 2 middle schools, you have a high school, and you have a slew of elementary schools. So that encompasses the population and diverse culture that we have to deal with. And here we are now addressing it and having a structured platform moving forward with the Thrive Coalition.
Right.
So we have our work cut out for us, and it's gonna be exciting, because I see from the people that are part of this is an all-star team. You have a lot of influential people within the community that do the same thing, and here you have this coalition that brings us all together in a common goal in addressing drugs and alcohol and tobacco products. So we're really excited for this.
We are too, and that's why I wanted to bring you on, because I really feel like this is a great partnership moving forward. And we know we had you on yesterday, Sarge. We wanted to bring on Kathleen and Vera to just kind of to break bread with us, and let's get on the same page moving forward with this opportunity that we have to work together on this. I want to bring it in, guys. Let's do a virtual fist bump. Okay, let's bring it in here, and let's pledge to do what we can to be that village. Let's make this whole island a village to raise healthy, drug-free youth. And we invite everyone out here on the link to thrive with us. Bring it in, guys, to thrive on 3. 1, 2, 3. Thrive!
Thrive!
Right on. Be easy, okay? Wash your hands, and we'll see you guys. Kathleen, I told you, anybody you want to get on anytime, let's make it happen.
Yeah. Next week?
Will do.
Okay.
And thanks for the plug. It really is, the awareness that you guys put out there with the partnership with the media. It's important because we get that little jingle in their ear and everything. It starts with the parents who are pondering the thought, what can we do? And it's part of advertising, marketing. And it's really, like I said, I've never had this opportunity working with the Guam Police Department, marketing experts like you guys. So thanks again. And we're excited for this.
Hago Moss, Kathleen, Vera, thank you. Sorry.
Thanks, guys.
Love you guys. Be safe, okay?
Thank you for having us on.
All right.
Stay dry. It's Palaxi to the Maxi out there.
Safe, guys.
Okay, we'll see you.
Bye.
I just like that. Let's bring it in, guys. Right on.
That was cute. Especially after a show like today. That was cute.
Yeah, I'm just, hey, guys.
And I'm glad we ended it on this note. Something positive, and this is great.
Hey, miss a link, miss a lot. Some of the takeaways this morning, Sabrina.
Ooh. Download the COVID alert up.
Yeah.
Furloughs, not furloughs.
Oh, God. Man.
Let's work together.
Yeah, let's work together. Berita Posnev's a liar, according to the public auditor. Mayor
You
Johnny.
just got to watch that interview.
Yeah, Mayor Johnny Kanata says 200 COVID-19 tests in Umatic, simply not enough. Dr. Hoa Wen of the Physicians Advisory Group, 20 to 40-year-olds, stay home.
Maria Pangilinan said they're still moving. Maria Pangilinan from the GEC said they're still moving forward at the moment to do village satellite voting down in Molesso first,
Right.
but they do plan on, they have a schedule of villages they plan to visit.
In-office voting is supposed to get underway this Saturday. And you're supposed to
Correct.
make your appointment, 477-9791. But
Dr. Hoa had said that he is thinking that the PCOR 1 lockdown will be extended because we haven't seen the drop in the test positivity rate, because we haven't seen any drop in the hospitalizations. And we know where we are with the ability for public health to mass test. It's kind of non-existent. Well, unless you consider 200
they
people
said
mass testing.
they switched their
Yeah, well, they got to tell the triggers that, because we didn't switch the triggers yet.
all you got to do is change it.
That's it. It's so easy. That's all they got to do is change it. Mass testing, we can't do that. Let's take it out. All right. Before we get back into the sarcasm-licious and the show.
Yeah, that was sarcasm, people. We weren't for real.
Yeah,
Okay.
come on. Hey, so thank you guys again to our sponsors, First Hawaiian Bank, Calvo Enterprises, and IT&E. I wanted to do a special thank you to @Guam Funny Memes.
Yes. Guam Funny Memes for these island-style face masks. My friend Anthony Sayama used to be one of our beat reporters. Reached
Right.
out to me. He's like, "Hey, Bri, I want to give you guys some masks." And I was like, "Well, okay." And so he came through. He came by yesterday and dropped off some masks for us, and really appreciate it. And I actually have bought quite a few of these masks already.
Yeah.
And so I had worn the Santa Maria and Cameron on the news
Right.
last week, I think.
That
And
was
so,
cool.
yeah, I really appreciate it. Yours is really nice, though, Chris.
Yeah, so mine, I'm rocking this. I don't know what he calls it, but to me, it
Wave?
kind of reminds me of the Japanese style waves.
I was just about to say, I've
yeah.
seen that. I've seen that design where they have, like the big waves, but with the Guam seal, it's really nice.
Yeah.
Is
and,
that silk, by the way? It's got this shine to
It's
it.
polyester,
Oh, okay.
but it feels like silk against my mustache.
Nice. I'm sure that's very soothing.
Tickles a little bit. Sorry.
But I
Bree-
like these. I like
Yeah,
these because
you-
it has the
There's an adjustable. This is
Right.
really cool, guys. Let me show you this. I'm going to
It's
take off my
really cool.
headphones. But, for when we're having a really good link show and my head gets big in the middle of the show, I can go ahead and I can adjust it because everyone around here seems to want to tease me about I'm big-headed.
Sorry, I just walked right back in the room. But did you guys? I'm sure you guys mentioned the fact that we're actually going to show people how they can do things tomorrow, right?
We didn't yet
Yeah.
because we were trying to get out of here, but now we have to. So
Oh, okay.
we're going to do our nursing segment
Yeah.
tomorrow with the Guam Nurses Association.
right, and one of the topics is how to properly wear a mask and put on a mask. And
Because
so-
I don't know, at the beginning of the pandemic, I was getting it all wrong. Like with these surgical masks,
Yeah.
apparently I was getting it backwards, upside down. I thought
He
like,
even put it on sideways like this. I was
Yeah.
like, no, Jay, it's not a... What? What are you doing?
He's even wearing it over his eyes.
Yeah, again, sarcasm. Again. 10:09, guys, thank you so much. Hey, be safe out there. Wow, look at that rain.
Be safe. That's right. Stay home.
Yep.
And thank you to all our frontliners that are and essential workers that are out there. Thank you so much.
I just
Thank
wanna
you for
let you
everybody
guys-
watching,
Stay strong,
listening,
you guys.
streaming.
Right on. Thank you to Joe, sir, Jason, Master Control, Kengineer, and again, we got your 6 with our KUAM News primetime broadcast. Good job, Sabrina. My name's Chris. Está. Adios!
Bye.